You're ready, and you may call the meeting to order whenever you like.
Thank you kindly. Good morning. I would like to call the meeting on Interim Retirement and Benefits Committee to order on December 14th. Good morning to all of those that represent us here in Las Vegas and in Carson City, as well as those online with us. Chair Monroe Moreno is attending virtually and has asked that I chair this meeting today. So, Mr. Weber, will you please call the roll?
Senator Dondero Loop.
Here.
Senator Orenshall.
Present.
Senator Stone.
Here.
Assemblywoman Kasama. Assemblywoman Peters.
Here.
Chairman Moreno.
I am here.
Thank you, Mr. Weber, and please mark Assemblywoman Kasama as excused. And I would like to welcome our new senator, Senator Stone. Thank you very much for joining us. Before we move on with today's agenda, I would like to remind all committee members and members of the public to turn off or mute your electronic devices that you have. And if you're participating virtually, please remember to keep yourself muted when you're not speaking. Also, the chat feature in Zoom will only be used to communicate technical difficulties with staff. So those who will be providing testimony today, please remember to state your name for the record each time you begin speaking. Lastly, I do not plan on taking a lunch break today. Hoping that we're done prior to that. We'll move quickly through the agenda until we're done. So the first piece on the agenda is our public comment. So we'll move to agenda item number 2. This is the first period of public comment. There will be another one at the end of the meeting. Due to time considerations, each person will be provided 2 minutes to speak. Please remember to state and spell your name for the record and then begin your statement. To call in to provide testimony during the public comment period, dial 669-900-6833. When prompted to provide the meeting ID, please enter 818-958-7960 and then press pound. When prompted for the participant ID, please press it. Please press pound. The call-in information is also provided on the agenda for today's meeting. So I'll begin with public comment here in Las Vegas. Is there anyone here who would like to give public comment? Seeing none, I'll go to Carson City. Is there anyone in Carson City that would like to provide public comment? Welcome. Dr. Irvin, good to see you. Go ahead, please, when you're ready.
Thank you. Kent Irvin, K-E-N-T-E-R-V-I-N, State President, Nevada Faculty Alliance. Good morning, Chair Monroe Moreno, Chair Dondero Loop, and committee members. The state of Nevada is in the midst of an employment crisis. Agencies across the state, including the Nevada System of Higher Education, have extraordinarily high vacancies rates, and we cannot fill positions. It has come to the point where essential government services cannot be provided. Compensation and benefits for state employees, including NSHE faculty and staff, are not competitive as a result of years of neglect. After the Great Recession, state employees were hit with furloughs, pay cuts, and cuts to benefits. Those had not been fully restored by the time of the pandemic, when state employees were again hit with furloughs and drastic cuts to health care benefits. After recent high inflation, state employees' salaries and wages must be substantially increased by 15 to 20% to become competitive. Restoring benefits is also essential for recruitment and retention. Regarding the Public Employees Benefits Program, the PEB Board has proposed partial benefit restorations using savings from new programs that reduce costs. While we are concerned about any programs that restrict access to care, PEB is doing what it can. It now apparently needs IFC approval to make any improvements in benefits, even if funded by reductions elsewhere. The real problem is that the employer contributions from the state budget have not kept up with medical inflation for years and were cut after the pandemic. I have more comments about the PERS system, but given the time limits, I'll put those in writing. With the Economic Forum increasing the budget by over $2 billion compared with the current biennium, it is time to treat state employees as the dedicated public servants they are, so they can provide full service to citizens. Thank you.
Thank you very much. Is there anyone else in the Carson City room? Seeing none, I will go to the phones. BPS, would you please queue up the first caller if we have one? Thank you.
Thank you, Chair. To give public comment, please press *9 on your phone to take your place in the queue. Caller, you may begin.
Hi, my name is Sheila S., and I would like to put, it's spelled S-H-E-I-L-A, last name initial S, and Chair Senator Dondera Loop, Chair Monroe Marina, thank you for taking my comments today. I'll be as quick as I can here and stay under the 2 minutes. My comment is on the PEB plan to implement a cancer concierge COE network. I'm writing today to express my concern on recent PEB board meeting decisions and on the general lack of transparency and concern for the health and welfare of seriously ill state employees and retirees. Everything always comes down to how can PEB save money, despite the fact that there's been healthcare fund subsidies the last few years, requiring PEB to do more work to determine how to spend them down. The PEB board continues to limit employee choices in healthcare, all in the name of lowering costs. By way of background, I'm a cancer survivor and one of the approximately 1,500 PEB participants reported as having utilized cancer services, according to the recent PEB board meeting presented earlier this month. In my experience, once again, PEB has brought to the board and voted on plan changes without truly considering the impact it has on the many participants who are fighting for their life to catch, treat, contain, and eradicate the serious illness, cancer diagnosis. How PEB has PEB thought about surveying the people dealing with this horrendous diagnosis to see what their thoughts are on what is being considered at these PEB board meetings to contain the costs for life-saving treatment? Specifically, the PEB board recently discussed and voted on implementing a cancer concierge COE network earlier this month with the goal of saving $1 to $2 million annually. In PEB board materials, there wasn't any information provided on how this concierge service will impact participant choices in provider services or force oncology, doctor changes for existing employee, retirees, etc. In fact, PEB did not even commit to going out to RFP to find the best center of excellence provider. So PEB's going to limit the choices participants have to exercise their PPO insurance rights to see the providers they feel can best support their serious illness diagnosis while rushing to implement this high-level cancer concierge savings program as outlined in the materials. Just for the record, concierge is defined as a definition in the Cambridge English Dictionary, someone who is employed in a hotel, private club, or similar place to help guests in anything they need. If you go to Webster, the meaning of concierge is usually multilingual hotel staff member who handles luggage, mail, makes reservations, and arranges tours. How does a new
And if you
unnamed
could
cancer
wrap it up in
concierge-
just a minute, please. Thank you.
Yeah. Yes, into the either definition. It does not. I'm sure the service will be focused on forcing members like myself who pay over $900 a month in premiums for the PEB low deductible service, limit the places I can go for ongoing monitoring, future testing. How does this nationwide PPO and choices keep getting fewer and fewer? I picked the PPO because I wanted to research the doctors are best for what they do. Instead, I'm once again going to be left waiting to see how this change will impact me, just like when Aetna Signature Network was dropped after a year in contract and a multi-year contract last year. So I cannot understand how these continuous changes, all in the name of saving money, are not looked at holistically from an employee health and welfare perspective. Committee
Thank
members,
you very
please, at a
much.
minimum, require PED to do their due diligence and necessary time. This is all in writing. Please take the time to read it. I appreciate it.
Thank
Have
you
a nice
very
day
much.
and happy holidays.
Thank you so much for your comments. Next caller, please.
Chair, the public line is open and working. However, there are no more callers at this time.
Okay, thank you very much. Just as a reminder, there will be another period at the end of the meeting. So we will go on to the next item on the agenda, which is agenda item number 3, the approval of the minutes of February 8th, 2022 meeting. Members, a copy of the draft minutes is included in your meeting packet. They have also been posted online. Do any members have suggested revisions or edits to the draft minutes? There are no suggested edits. We will move on. And with that, I would entertain a motion to approve the minutes of February 8th, 2022, meeting of the Interim Retirement and Benefits Committee.
So moved, Madam Chair.
Thank you very much. Do I hear a second?
I would second that motion.
Thank you very much. So with that, staff, will you please assist us with discussion? Is there any discussion on the motion? I think perhaps we can do a hand raise from those online, and all those in favor say aye. 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 And online, if you'll raise your hand, thank you. Anyone opposed? Motion passes. Thank you very much. All right, we'll now move on to the main part of today's agenda. Today, we'll hear a presentation for both the Public Employees Retirement System and the Public Employees Benefit Program. We'll begin with agenda item 4, the Public Employees Benefits Program. To present the agenda item, we have here today Laura Rich, Executive Officer of the Public Employees Benefits Program. Ms. Rich, please introduce those who you've brought with you and begin when you are ready. Thank you very much for joining us here in Las Vegas.
Good morning, Madam Chair and members of the committee. I am Laura Rich, Executive Officer of the Public Employees Benefits Program. With me today, I have Ms. Carrie Eaton, who is the Chief Financial Officer of PEB. We are here today to present a plethora of information regarding the Public Employees Benefits Program. On the agenda today is a presentation of the audited financial statements of the program, as well as utilization reports, some coverage on our communications for the program, and the biennial certified actuarial valuation by our actuarial consultants, as well as the biennial review of the program, compliance review. In addition to that, those are the reports that are required by statute. We have also, in the past couple of years, have presented an additional report on, this is all retrospective reports. We are presenting an additional report on what is to come. So what the PEB board has approved moving forward for the plan year that is coming, that starts on July 1st. So we thought that's been very beneficial for this committee in the past, just to not only get what has happened in the past, but also what is happening moving forward. So with that, I'm going to start out by presenting just a little bit about PEB. I know we do have some members, new members on this committee, so I wanted to just kind of give a brief overview about the program itself. We, as a program, cover state actives and retirees, plus their dependents. And we also cover non-state actives and non-state retirees. When I say non-state, I'm talking about local governments, municipalities, those public sector entities who have joined the PEB program, who are a part of the PEB program. They're two different risk pools, so they are separately rated. We do offer medical, dental, vision, and basic life as part of the basic package. We also offer voluntary benefits too. So what I mean by voluntary benefits is there are buy-up life insurance policies that we offer, long-term disability, accident and critical illness, vision, things like that that we offer, even home and auto insurance. You can get that through our platform, and we have group-rated offerings through the PEB program. Our funding is, we get funding in two different ways. So part of it, and most of it, is the legislatively approved employer subsidy, as well as the employee premiums. Whatever isn't covered by the subsidy is covered by the employee premium. So it is the difference of those. That is what the employee pays. Although PEB does not receive any general fund dollars, agencies are paying that subsidy. So every employee that is covered under PEB every agency is paying a certain amount for that employee. And so that is how that funding happens. Our self-funded plans, we do offer 3 of them. We offer a consumer-driven high-deductible plan, which is offered statewide. We also have an EPO, which is similar to an HMO that is offered in the North. And we have a low-deductible plan that is offered as well statewide. We have one additional offering that is not a self-funded plan. And when I say, let me back up, when I say self-funded, it means that PEB administers the plan. So premiums that are coming in are funding the claims that are being paid out. With the fully insured plans, these are fully insured plans that are offered through a carrier and that are overseen by the Division of Insurance. The fully insured plan is an HMO, and that is offered in the South and offered by Health Plan of Nevada. Additionally, for our retirees on Medicare, we offer a Medicare exchange. This is an exchange where retirees can purchase plans or enroll in Medicare plans through the Medicare exchange. And we provide them, the program provides some HRAs, health reimbursement accounts based on their years of service, up to 20 years. Those HRAs are meant to pay for those Medicare premiums or any kind of out-of-pocket expenses that retirees do experience, healthcare related expenses. So I'm going to start out with some information based on the most recent action taken by the board at our December 5th PEB board meeting. I'll start out with some background. In 2022, the PEB board voted to utilize excess cash. So excess cash is any cash that has not been, that is over and beyond any of our required reserve categories. Much of the excess cash that we've had has resulted due to members deferring care throughout the pandemic. So during the closures, the shutdowns, and even after, in general, people were not accessing care like they used to. They were putting off elective surgeries, things like that. And so many health plans did see a reduction in the claims that they were paying out. And so the PEB board did vote to restore benefits that were cut in 2020 by using the excess cash that the program had. In addition to the excess reserves that were earmarked for the restoration of benefits, there are several other expenditures that were included in our budget as well to restore certain things such as the HRA reimbursements to retirees. So those were already, some of that cash was already earmarked. Once all of those things were factored in, PEB was left with $9.5 million in excess reserves. So before I go into what the PEB board decided to do and to approve, I wanted just to touch upon an employee survey that was released. Recently, there was a working group that was comprised of leadership from the governor's office, from PEB, from PERS, and the Division of Human Resource Management. Leadership got together and put together a short survey to really look at what is it that employees find important, not just in benefits, but in wages and in the whole compensation package. And so I was given permission to share this with the PEB board, and I felt like it was helpful for the PEB board to understand what these responses looked like from state employees. The survey received over 7,400 responses, which is a very, very good response rate. It went out to all active employees, state employees, NSHE employees, legislative employees. 7,400 responses is much higher than we've had in the past for any PEB survey that we've put out. What I do want to point out is that there's two questions here that I chose to highlight. The first one is just overall about employees and what they found important in as an employee. And obviously, I think it's expected, higher wages and salary by far was the most important quality or benefit that people rated. The second one was lower health insurance premiums, which I personally was a little surprised with because we had recently presented to the PEB board a comparison of premiums within, we compared PEB with other state and local governments in Nevada, and our premiums were very similar to what other public employers are offering their employees. I think the difference here is that state employees, their wages are much lower than some of these local governments, and so the relationship between the wage and the premiums, there's a disparity there. So I think that's where it comes from. Even though our health insurance premiums are very comparable to other health insurance premiums in the private or in the public sector, our wages are not. Additionally, there were some other items that ranked high. Employer matched 457 contributions was high up there. More robust health benefits. Question 4 was specifically about PEB, and again, lower health insurance premiums was ranked the highest. That was what people wanted the most, and lower deductibles. So lower deductibles, lower out-of-pockets, those are first dollar expenses. And so I think what we took away here is that people want more money in their pockets. It's not only just in wages, but in lower health premiums and lower deductibles, things like that. But you can see there's some good information here, and I believe legislative staff has shared the entire survey with the group. But I'm happy to share that if you would like a copy of it. So the first item that the PEB board chose to approve was an additional HRA or HSA, health reimbursement account or arrangement and health savings account, one-time contribution for all active state employees. So this was only for the actives, not for the retirees. There was a sense that actives, because actives contributed to most of that excess, the board wanted that to be directed back to the active employees. And so the board actually approved a range between $300 and $350 contribution to be made on July 1st of 2023. I think we're leaning more towards $350 depending on the population on the enrollment. I think we're going to be able to get to that $350 mark. And so anyone on the high deductible plan is eligible for an HSA. Those folks will get an additional $350 in addition to their $600 HSA contribution that comes with that plan already. Anybody on any of the other plans, so the low deductible EPO and HMO, will be receiving a $350 HRA. The difference there is that IRS guidelines do not allow for HSAs on any plan other than a high deductible plan. So that one-time benefit will be distributed on or around July 1st of 2023 at the beginning of the plan year to anyone enrolled on the plan at that date. The second item here is so we've had a $1,500 annual limit on our dental annual maximum benefit limit. And that $1,500 has been in place since 2011. We did a little bit of analysis, and that $1,500 is still in line with industry standards, but many plans are considering an increase to $2,000 just because the cost of healthcare and the cost of dental in general are rising, and they're rising fast. And so the projected annual cost for this is about $750,000, and the board did choose to raise that to $2,000, to that annual maximum limit to $2,000 a year. We also, and I'll talk about this later on in a later agenda item, the elimination of the annual benefit limit for pediatric dental was approved as well as a result of a compliance audit finding. We also added the addition of medically necessary abortion care to the existing travel benefit. So today, PEB does offer a travel reimbursement in certain situations. So for example, organ transplants or bariatric surgery, those are done in centers of excellence. And so what the plan does is reimburse travel for those folks who have to travel to a center of excellence to receive those types of services. The travel is reimbursed at GSA rates, and so it's lodging and travel expenses, meals, things like that. PEB does not currently offer coverage for elective abortions, but does provide coverage for medically necessary abortions. So in this case, PEB covers members throughout the country. We've got not just actives, but retirees. Those retirees, actives, they tend to have dependents who may go off to college, who may be, scattered around the nation. There are potentially people who could reside in a state where their ability to access medically necessary abortion care is limited, and therefore they must travel outside of their state to receive these types of services. The projection is not very much. It's the cost of this is somewhere between $25,000 and $50,000, just because of we project only a handful of these types of situations, but the board did approve the travel benefit for that. They also approved a weight loss program called Real Appeal. It's currently offered to our HMO members. This is a really neat weight loss program that helps those that, and it really is not limited. So you don't have to have a diagnosis of obesity. Anyone can join. Anyone over the age of 18 can join. And it provides tools such as food scales, weight scales, counseling, things like that. And there is a savings associated with it. It's about $170,000 a year based on the cost versus the ROI that is expected. We also approved the addition of a cancer concierge program. Currently, PEB does offer case management services for not just cancer, but all kinds of complex care conditions where members need that extra assistance with coordination of care and really just navigating the health insurance system. Cancer concierge is just an enhanced service where members who are diagnosed with cancer can get that extra hand-holding that they may need to navigate their complex medical situation where you've got different providers offering different care, and you have to coordinate all that care. And it can become a lot of work for someone who doesn't know how to navigate the system. And so PEB is going to RFP for this service. We expect to be able to RFP and implement by July 1st. This is elective. It's something that anyone that is undergoing cancer care can take advantage of. It does not force anyone into a certain network, or it really just is extra hand-holding for those members. And depending on the way that the outcome of the RFP, it could be even potentially things like helping them navigate their health insurance bills, right? And what goes to your deductible and what goes to your out-of-pocket expenses. There's a variety of different levels of that. So once we do RFP for this, we'll have a better idea of what that service is going to look like. But the projected annual savings for this is $1 to $2 million a year. This is an enhancement. It's a benefit for members. In addition to this, we have the addition of a medical travel program. Medical travel provides members, again, this is elective, it's an option, but it is not a requirement. So members that might have some kind of surgery coming up where they may be able to have that surgery locally at local hospital, but they have another option that they may have to travel for, but it's higher quality, lower cost. And so with this service, you have a provider who handholds those members through those options, and so that they can receive higher quality, lower cost services if they choose to. Sometimes you can incentivize these types of programs where if you utilize this option, maybe we will reduce or eliminate those out-of-pocket costs. We haven't gotten to that point yet, but it does. Not only is this a cost savings to the member, obviously, but it's a cost savings to the program too, with a potentially better outcome because you're sending people to centers of excellence that have better outcomes for that certain type of procedure. Again, we have to RFP for this as well, but the projected annual savings for a program like this is $1 to $1.5 million a year. We've also added Hinge Health, which is a virtual musculoskeletal physical therapy program. This provides ongoing coaching and guidance. It's something that you use either on your laptop or on your phone, and it provides, it's an alternative to that in-person physical therapy. Again, it can be incentivized by reducing and eliminating any out-of-pocket costs for members. And the annual savings is projected to be $1.4 to $2.4 million a year. Other states that have put this into place have been very, very happy with the results of Hinge Health, and so we're very excited about potentially putting something like this into place, especially knowing the provider shortage that we have in the state of Nevada. Anything that we can do virtually versus in person just provides another option for people. So I think I'm going to stop right there and see if there's any questions from the committee before I go on.
Thank you very much. And Senator Orenshaw, go ahead, please.
Thank you very much, Chair. Thank you, Director Rich, for being here. Question about the Cancer Concierge Program. I think you estimated $1 to $2 million in projected savings. How do you see those savings being generated? It sounds like a good program. I'm just wondering how you see that translating into savings.
Thank you for the question. Laura Rich for the record. I'm going to give you an example. Actually, when I was explaining this to a board member, she gave me a very good example that I think is very applicable in this situation. She has a family member who is currently in hospice care, has cancer. When she was diagnosed with cancer, she had to go to a GI specialist. She had a lot of difficulty getting into that specialist, navigating the system, getting through what she needed to do to coordinate that care. There were many delays. Those delays resulted in worsening conditions and resulted in care that she would not have needed had she been able to get through the system, navigate through the coordination of care, and receive those services sooner than later. And as a result, she ended up having a lot of GI-related problems and surgeries because she did not receive the care she should have in a timely manner. So in this situation, you have a team of experts who are hand-holding these members through that episode of care and coordinating the care between all of the doctors. Providers aren't always talking to each other. We would hope that they would, but they don't. There's siloed services. And so a lot of it falls on the person receiving the care to be able to communicate to each of the doctors and to be able to coordinate that care. And so a lot of these folks can't do it. And so now you have this cancer concierge provides that extra level of care to ensure that these members are receiving, these patients are receiving the timely care that they need, and at locations that are high quality, low cost, if possible. And so not only is it a better outcome for the member, but it does result in savings for the program because you are offsetting services that potentially, or you're not offsetting, but you are reducing the, surgeries and things like that are necessary because of a result of delayed care, if that makes sense.
It does. Thank you, Chair. And Chair, may I have a second question about it?
Absolutely. Go ahead, please.
Thank you, Chair. On the out-of-state travel benefits, so that members can go to a center of excellence, I see the projection is that perhaps only 5 to 10 members may use it, if I'm reading that correctly. Where does that come from, and what if there are more members that, let's say, need to go to take a Cleveland Clinic or New York to Atlanta, some center of medical excellence? Will the funds be exhausted, or would there be provision if there are more than 5 to 10 members that need to travel out of state?
So Laura Rich, for the record, I think the 5 to 10 is actually for the abortion care. So we're only predicting a small number of medically necessary abortions that are in areas where abortion services are not readily available. For the actual medical travel benefit, there's going to be a lot higher number. I can't put a number to it off the top of my head, but it is elective, and so folks that, let's say that you need a hip or knee replacement, it's going to trigger, and you're going to get that option of, hey, you could have it at this local hospital. You could have your knee or hip replacement at this local hospital. But if you travel maybe across state lines, we're going to pay for the travel, we're going to pay for the lodging, we're going to pay for someone to go with you. You're going to have potentially a much better outcome because it's got, higher quality ratings, and the program is going to then benefit as well because there's going to be better discounts. And so that's how we're going to realize those savings.
Okay. Thank you very much, Director. Thank you, Chair Dondera-Loop.
Thank you very much. Any additional questions here in Las Vegas? Online, Assemblywoman Peters, did I see your hand up?
Yes, thank you so much.
Please, go ahead.
Thank you. So I have questions regarding the survey of users that you conducted. And first of all, I was wondering if you conducted this in consultation at all with the Department of Administration, who's currently working on the retention and recruitment project that we funded through IFC a couple months ago.
Assemblywoman, could you turn up your volume just a little bit? We're having just a little trouble hearing you on our end.
Oh.
And then I'm sorry to ask you to repeat the question, but I think Ms. Rich may need to hear it again.
No, that's okay. I'm looking to make sure I have my microphone on. Looks like I do. I'm going to move a little closer to my computer. Can you hear me better now?
That's better. Thank you.
Yeah. Okay. And my question had to do with the PEB survey of users and wondering if you conducted this in consultation with the Department of Administration at all. They've been working on a recruitment and retention plan and project that we funded through IFC a little while ago. I was just wondering if that was a duplicated effort or if it was in consultation.
Laura Rich, for the record, thank you, Assemblywoman Peters. So this survey is actually not a PEB survey. It was a survey that was a collective effort between the Department of Administration, or DHRM, which is a division of the Department of Administration, as well as the Governor's Office, PERS, and PEB. So it was a collective effort. And so, no, it was not a duplication of services or, of efforts. It was really a coordination of efforts. And so we're benefiting from the results of this survey collectively as well.
Fantastic. I love it when we leverage our projects together. My second question, if I may, is related to some of these added benefits for services and kind of plan expansion benefits. Do you conduct any kind of impact assessment for these kinds of changes on your members?
So, Laura Rich, for the record, when you say impact assessment, we actually, when we do the analysis, we have actuaries who not only do the analysis of what kind of impact each of these services would have, meaning volume, meaning financial impact. But we also look at for example, hinge health. Musculoskeletal conditions is, I believe, the number 6 on our cost spend for the medical, for a diagnosis on the medical program. So it's something that ranks pretty high in how much money we are spending, and which also means it's not just the cost spend, but it also means that members are suffering from musculoskeletal conditions at a pretty high rate. And so we try to bring programs that address some of this, not just obviously to reduce the cost savings for the member, but in all of these programs, there's an additional benefit to the member as well. All of these are an enhancement. We're not limiting services, so we're not directing folks to a certain provider or certain network. It is, all of these are an enhancement and an option for members. And so we're hoping that all of this is helpful to members, but at the same time, it's providing a cost savings in many of these situations to the program as well, because you have better outcomes, and so you have healthier population.
Yeah, I noticed that pregnancy-related issues are one of the higher cost issues that your members have dealt with, and I didn't see any of your changes addressing any of those issues. So I'd be curious if you have any kind of reporting regarding like how you do that impact assessment related to how it affects the member consumer. And if you do, I'd love to see that.
Laura Rich, for the record, I can definitely share the analysis that we received from the actuaries on all of this.
Madam Chair, I have one other question that wasn't covered.
Yes, please go ahead.
Thank you. So we didn't talk much about this, but in my notes, one of the the recommendations from the PED board was opting out of the Mental Health Parity and Addiction Equity Act. And can you tell us a little bit about that decision and how you guys came to that conclusion?
Laura Rich, for the record, yes. However, that is, if you would like me to address it now, I'm happy to. However, that's in a later agenda item, and I plan on addressing that in a later agenda item if that's okay.
Okay, I can hold my question. Thank you.
Okay.
Thank you very much. And if you've completed your questions, Assemblywoman, I will add one to this. And if you'd like to answer, how does PEB sort of plan to seek approval from the Interim Finance Committee or the legislature to expand some of these excess reserves?
Thank you for the question, Chair. So, Laura Rich, for the record, this is because we are in the midst of building the governor's recommended budget. If typically in an off year, if the PEB board chooses to use excess cash for any kind of benefit enhancements, they would go to IFC for approval. This year, because we are in a we're entering into a legislative session, it may actually be built into the governor's recommended budget, in which case we likely wouldn't go to IFC, is my understanding. It would just go through our normal budget hearing process. Because GovRec is confidential, we still, can't divulge whether it's in the budget or how it's built in, but I do foresee if it is built into the budget, then it would go through the normal legislative process versus going to IFC.
Thank you very much. All right, if no one else has any additional questions, let's go ahead and we'll move on.
Okay, so Laura Rich for the record again. So the next section is on reports of our audited financial statements. I'll make this, short and quick. Our independent auditor audits our financial statements on both the active and retiree funds. They do this in accordance with generally accepted accounting principles. So they're going to be looking at internal controls, compliance, accuracy, things like that. Our current auditor is Clifton Larson Allen, and so they conducted this audit. And as in with any audit, there were a few findings, but overall the opinion on both was determined that PEB's financial statements fairly represented the financial position of the program. So, overall, it was a favorable determination on our audited statements, but I'm willing to take any questions related to those.
Any questions? All right. I don't see any, so go ahead, please.
All right, Laura Rich for the record again. This section is on our plan utilization. This is really the meat of PEB. This is what's happening in our plan. This is what drives our budget. This is what drives health insurance costs, and really what we look at in terms of not just our budgeting and finances, but in our population, what's happening. And so I've divided this up. There's a lot of information. There's several hundred pages here of health insurance related information. I've really tried to pare it down. I know health insurance is a complicated subject, and there's a lot of data here. I'm happy to answer any questions, but I really have pared it down to the bare minimum that I think is just the highlights of what is happening in the plan. So I'll start with the consumer-driven health plan. That's our high deductible plan. The enrollment was down significantly, and I think we've seen that just, because of the vacancy rates in the state. And this is through June 30th of 2022. This is even, lower today if you look at our enrollment. So the plan is from July 21 of June of 22. The enrollment was down significantly. Overall plan spend was down significantly. However, if you look at how much we were spending per member, it was up. It was 16.5% higher per person. So yes, we've spent overall less, but that's because our enrollment was low. But if you look at that, per member number, we're spending a lot more on healthcare per person than we were last year. So in prescription utilization, again, it's pretty similar, where we had our net claims overall, the amount of claims went down, and that's, again, largely due to enrollment. Our gross cost was down as well. But when you start looking at, again, the per member per month per person that we're paying for prescription drugs, it was up almost 5%. The average that the plan was paying per person was up, or per claim, was up 5.2%. And the average member share, so that's what the members are paying, was up about 6.5%. Our ER utilization, again, was up quite a bit, 27%, but our per visit cost went down a little bit, 6.2%. That's really just because we're coming out of the pandemic, right? And so you're seeing this is July of 21 to June of 22. So you're comparing it to the previous year where we had a lot of ER visits due to COVID and the pandemic. So the severity and the extent of ER incidents were at a lower cost, right? They were less. And so that's why you're seeing, even though you have higher utilization, you're seeing lower cost per visit. High-cost claimants, these are what we call claimants that are over $100,000 threshold on any of our self-funded plans. High-cost claimants really drive the spend on the plan. High-cost claimants we look at them pretty closely because, like just recently, we had a one-member high-cost claimant of $5.5 million. That's a lot for one person, and that's why we have catastrophic reserves, is to cover those types of, if you have a few of those happen per year, those are not things that you plan for. And so those high-cost claimants are really something that have to be monitored and are what drive the cost of the plan. Those high-cost claimants on the CDHP, we had about 43% higher than in the previous year. But the good news, again, due to the pandemic, when you're comparing it to the pandemic, the average cost of that high-cost claim was down just a tiny bit, to 2.2%. On the CDHP, something of note is that our inpatient claims or costs went up 14.7%, and our outpatient claims went down 20.5%. I've taken the time to put together on each of these plans the top 10 costs by diagnosis, because I think those are important. And Assemblywoman Peters did talk about the pregnancy-related disorders. That is, we call those the $1 million babies. They are, when a pregnancy results in a neonatal type situation, those are very, very high cost claims. And so pregnancy related disorders, you'll see them on every one of, in fact, all of these lists are very similar regardless of plan. Obviously, COVID was still a very high cost during this time period. Cancer always ranks up there. Mental health is on all of these lists as well. As I said, musculoskeletal and cardiac, they're all, you're going to see those on all of these lists. So then moving on to the low deductible plan, this is a little bit different. So this was the first year that we had the low deductible plan. For those of you on the committee who have been following PEB for a while, you've heard from members that there was a desire to bring back a low deductible plan. People were they didn't feel like they had the choice with either good choices with a high deductible plan and an EPO HMO option. They wanted something in the middle. And so we brought back a low deductible PPO plan, and that's kind of a middle option. So it's a little bit costlier in premiums than the high deductible plan, but you have a copay type scenario for most of your most common services, so primary care and generic drugs and things like that. And so it's a kind of a hybrid between the EPO and the CDHP. It's a middle option. So because this is the first year of the low deductible plan, we couldn't really compare it to prior year performance. So instead what we did here is we're comparing it to raw numbers on the other plans. So the average enrollment, again, it's fairly low compared to the CDHP. I will tell you that this plan year, we had a lot more people move over to the low deductible plan. This was the first year. I don't think people really knew of it, or maybe they were just hesitant to move on to that plan. But we saw a lot of migration this most recent July over to the low deductible plan. The medical cost per member per month, you see it is a little bit lower than the CDHP and definitely a lot lower than the EPO plan. ER visits you see are fairly, comparable to the CDHP, but again, lower. The average paid here is ER paid is a little bit higher than the CDHP. We're looking at PMPM in prescription drug. The plan definitely picked up more of the cost on this plan for prescription drugs. And then the members were paying less on this plan. And it's just the way that the copays are set up and versus the CDHP. In-network utilization, very comparable as well. It uses the same network as our CDHP and EPO plan. So it's next year we hope to have more data on it, but I think that people are overall fairly happy with the introduction of this plan. Again, on the low deductible plan, you see cancer as being the #1 driver in pregnancy. So you're seeing a lot of these same conditions on the list as the cost drivers in the plan. And then we move on to the EPO, which again, this is similar to an HMO. It's a regional plan, so it has no out-of-network coverage. The EPO is offered in the north. Our enrollment, similar again, our enrollment went down. Our plan spent went down significantly overall. However, on the EPO, our plan spend actually decreased just a tiny bit, 1.4%. This is the plan where you're going to see the highest percentage of people with chronic conditions. This is the plan that it has higher premiums, but the copays and the out-of-pocket expenses are much less compared to the CDHP. So a lot of those with more chronic conditions are on this type of plan, or it draws more people to the EPO. The prescription drug utilization, overall, again, you're going to see that the net claims went down almost 11%. Our gross cost decreased about 10%. But again, that PMPM, if you look at the per member per month, it went up slightly, half of a percentage point. And the average share per claim that the plan paid was up 0.4%, and the average member share per claim was up 2.5%. So it was pretty stable for the most part, but it's really just the way that the EPO functions. ER utilization, again, you see pretty similar as to all the other plans. You see the utilization increase and the per visit cost decrease. The high cost claimants you're going to see this again, 10% higher, not as high as on the CDHP, but you're seeing a jump in high cost claimants, and the average amount of those high cost claims did decrease slightly, 4.7%. On the EPO, again, very similar. COVID was the #1 cost driver in that plan year. Pregnancy-related disorders, musculoskeletal, it's very similar conditions that are driving the costs here on this plan as well. And then on the last plan is our HMO. Again, this is not a plan that is self-funded by PEB. We actually pay our vendor, Health Plan in Nevada, a per member per month fee, and they provide coverage to the members. This is a plan that is overseen and regulated by the Division of Insurance, and so it is not self-funded. So we get a little bit slightly different data. We're not as concerned overall because we're not responsible for the claims on this plan. We are responsible for the per member per month, and so those do, eventually, with the contracted rates, rise with the rise of health, the cost of health insurance. But overall, again, you see that the enrollment, it dropped just slightly, 1.6%, but the medical PMPM on this HMO, it went up 35.4%. So per member per month, this plan is spending a lot more per member. The HMO is different. I do want to add that the HMO is different because it sets fixed per member fees with the providers. And so regardless of, on the self-funded plans, we're not paying providers a per member per month fee. We're not, it's pay per service, right? And so with the HMO, it is not. Typically, the way that these models work is providers receive a fixed rate to provide a certain type of service. And so because of this, the HMO doesn't experience the same kind of impact as the self-funded plan. So for example, during the pandemic, when our self-funded plans saw a huge amount of claims deference where we ended up with a lot of excess because we weren't spending money on people going to going and getting those elective surgeries and things like that during the pandemic. That same thing didn't happen on the HMO because of that model of the fixed cost. And so you don't see the variance that you would on the self-funded plan. But again, if you look at overall, if you take into account the medical and prescription drug PMPM, the costs have skyrocketed on this plan, almost 28% here. But you see similar ER utilization, very similar high cost claimants, again, up 29%. The difference here is that the amount per high cost claimant did go up about almost 23%. The disorders here are a little bit different. The top 10 costs by diagnosis, the HMO's reporting that mental health disorders are #1, right? So we had mental health is on all of these lists, but this was the highest on the HMO. They have, other incidents here where hypertension, diabetes, things like that are making this list. So this is the top 10 on the HMO. Something that was interesting here is that their inpatient claims went up 80.4%. That's big. And their outpatient claims went up only 9.5%. So it was a little bit different than the other plans. So with that, I know that's a lot of information. Believe it or not, this is about 2% of the information that was provided in the report. So I really did provide a very, very high level kind of story of what's happening on the plans, but I'm happy to take any questions or clarify any information from the committee.
Thank you very much. It is a lot of information. Any questions? Senator Orenshaw.
Thank you very much. A couple of questions, if you'll indulge me, Chair. Is IVF covered for folks who are trying to have a baby but are having trouble and want to do in vitro fertilization? Does PEB cover that?
Laura Rich, for the record, typically no. IVF is not. I'd have to look specifically in the master plan documents for the coverage, but typically no. IVF is not a generally a covered service.
Okay, thank you, Madam Chair. In terms of some of the savings that have been you've talked about in the excess reserves we've had, do you think some of that comes from the vacancy rate? Positions that are not filled right now, and should that be counted as savings, since hopefully we'll find folks who want to fill up those positions in the future? I just wonder how you handle that in terms of whether that's really a savings or if it's kind of a phantom savings, since hopefully we'll find folks who want to work in those positions in the future.
That's a very good question, Senator. Thank you. So Laura Rich, for the record. So our program's a little bit different. So you'll hear PERS present after us, and it's different than PERS because PERS is paying out the same benefit, right? And so they've got a pool of people that they're paying out a benefit to, but the revenue that's coming in from those current workers is much lower, right? With PEB, it's not the same way, because even though we are getting less revenue from employees, right, because of the vacancy rates, we're paying out less in claims. So our claims are dropping, as well as the revenue that's coming in from premiums. And so generally it aligns, and it rises and decreases at the same rate. Now, that all depends on what your population looks like, because if we're keeping the older, for lack of better words, unhealthier population, whether they're older or younger, it may, if you've got a higher incidence of chronic conditions in the folks that you're keeping employed, then obviously that does have an impact, because you have you're paying out more claims and bringing in the same revenue. So, but generally, as long as the type of employee or type of person that you are covering remains steady, then the revenue that you're bringing in is in line with the claims that you're paying out.
Thank you very much. And Madam Chair, just one last question, if it's okay.
Please.
Thank you. And I should have asked this when you were going over the audited financial statements. I don't know if they've been approved by the PEB board yet or not, but once they have, can those be shared with LCB physical staff for us to have in the future?
Laura Rich, for the record, yes. So this is the previous year financial statements. In the past few years, we've been behind the curveball a little bit, and so because of the timing, the most recent ones don't usually make it to IRBC, and so we're 1 year in arrears, but yes, definitely we can share those with the committee as the new financial statements are released.
Thank you very much, Ms. Rich. Thank you, Chair.
Thank you. Senator Stone, did you have a question?
Thank you, Madam Chair, and the panel. It's great to be with all of you. And Ms. Rich, thank you for the presentation. I'm kind of just absorbing everything like a sponge. Just a few questions. The HMO that you talked about, you mentioned that there's no risk to the state. I assume it's a capitated plan.
Correct.
And are you finding that the trend is that more people are enrolling in the capitated plan as a way to save money, co-pays? I know it's more exclusive of a network. You can't really go out of network. You got to stay locally. So what are the dynamics as far as growth of the HMO plan? And then secondarily, with all the plans that we have, are we making the investment in the state for preventative care? so that we can, in the future, begin to see a healthier population to ensure?
Those are both very good questions. So your first question, Laura Rich for the record, is so the HMO enrollment has actually been dropping, and it's a complicated formula, but I'm going to try to explain it in a very high level, 10,000-foot view manner. So we have an EPO in the north and an HMO in the south. They're both very similar plans. Our EPO is self-funded, whereas the HMO is a fully insured product. We blend the two rates, if that makes sense, right? So the HMO is actually, because the cost of care in southern Nevada is lower than in the rurals, than in northern Nevada, the cost of that HMO is actually much lower than what it is being offered at. And the reason why is because we blend all of the other plans, and so we are a statewide plan, and we don't offer premiums at a lower reduced premium for the southern Nevada population versus the northern Nevada population. So those are blended, and because of that, the EPO in the north drops a little bit and the HMO increases a little bit. And so the HMO enrollment it's been pretty, I would say, consistent over the last few years, because we were seeing a spiral, and enrollment was dropping. When you drop enrollment, the smaller the risk pool, the more expensive things get, right? And so we've made some adjustments so that doesn't happen. But because of the blending of the plans, it definitely, does have an effect. A lot of people just like either the high deductible plan or the low deductible plan. The high deductible plan, you are able to contribute to your HSA, and you can't do that on other plans. And so there are people that just like that high deductible plan for that reason. And then the low deductible plan is very similar to the HMO without the high premiums. And so there was a draw there as well. So the HMO, to answer your question, has been, I don't see, there are people that really like it, and that will continue to remain on it. But there's a lot of draw. A lot of the draw to the low deductible plan is coming from the high deductible rather than the HMO. To answer your wellness question, yes, PEB did have, in the past, we have put into place wellness programs in many different shapes and forms. So prior to my time, there was a wellness program in place where if you participated in the wellness program, members did receive a premium reduction of $50. So a lot of members actually got free insurance if you were an employee only on the high deductible plan. That was actually eliminated by the legislature at one point. The funding was cut off. And so, again, this was before my time, and so this was, I remember as an employee, I wasn't very happy about it myself because I was getting that $50 premium reduction. In addition, I would say 5 or 6 years ago, we did have an incentive program where we were funding HSA dollars if members went to seek preventive care. So if they went and did they went and had their primary care visit, they got their dental exam once a year and a cleaning, and did their lab work once a year. Again, that was eliminated by the legislature as well. And so PEB is a little hesitant, I guess, to put those plans into place because of the aversion to them by the legislature in the past. personally, I think that it's something that, we should take a look at moving forward again and potentially explore, because preventive care obviously is very important and is the way that, the most important way to keep members healthy, right? So.
Thank you very much. Any questions from online? Seeing none, we'll continue. Thank you.
All right, Laura Rich again for the record. So as part of this section, PEB has included its communication plan. It's a living document, and it's something that we work on constantly to improve, because communication in our plan is a real challenge. It is difficult. We cover a lot of different types of employees. We cover actives, we cover retirees, we cover those in Nevada, we cover people nationwide and even globally. And so getting through to members has been always a real challenge. And especially in a year, you heard a public comment, there was a lot of change. There's been a lot of change at PEB over the past few years. We had to go out to RFP for almost everything in the last 3 years. Every single contract has gone out to bid. And this was a result of a legislative audit finding a few years ago. And so we've had a lot of change in contracts, in vendors, in networks, things like that. And so there's been a lot of change, and members they've received a lot of communication. We communicate to members either by email, U.S. mail. We also leverage HR representatives at agencies. We work with stakeholder groups. So, for example, the Retired Public Employees of Nevada, RPEN, we work closely with them to communicate to retirees. It's very challenging to get through to people. Sometimes you send something in the mail and it's ignored. You send member communications, it goes to spam, right? And so it's something that we are working on, but I can't stress enough how much of a challenge it has been to really get our members to read our information and to really understand our information. And that being said, if you're flooding them with information too, you have to really pick and choose. How often do you want to send communication to members? Because at some point it's information overload. And so this is something that we work on daily to improve and figure out ways to better communicate to members. But we have put out a whole lot of communication, and if you look at our communication plan, there was a lot of information sent out about COVID and COVID coverage, plan benefit changes and vendor changes. We had an eligibility and enrollment system overhaul during this plan year where it didn't go quite as planned, similar to the Smart 21 project that the state went through. PEB had it was the same vendor, and we ended up having to terminate that contract and go back to our old eligibility and enrollment system. That was a lot of disruption to members and a lot of member communication regarding different challenges that we had during that time frame. So members did receive a lot from PEB during that time. We also put on open enrollment meetings every year. They're virtual. We used to go in person prior to COVID all over the state and put on open enrollment meetings. Now we're doing them virtually. They are interactive, and so people can participate and ask questions in real time during those open enrollment meetings. We have all kinds of, Medicare type informational sessions for those either active or retirees that are going on, moving into the Medicare exchange. And we've also put on flu shot clinics, vaccine clinics. We even included shingles this time around. And so we've done a lot of communication trying to get folks into our clinics as well. So there's a lot of communication that's going out by PEB. We are every day trying to improve that and find new ways to, and better ways to communicate with members so that it's more effective. So I will stop there for questions.
Thank you very much. And I understand, because sometimes when you get things, you don't know if they're junk mail or real mail. So any questions from the committee? Okay, seeing none, you made it clear. You may move on. Thank you.
All right, so Laura Rich for the record. This section is on our OPEB liability and our actuarial valuation. Typically, this is the part where I would pass it off to our actuaries and have them present this piece, because I am by far not an actuary and do not do this valuation. However, we recently, like I said, we've changed a lot of contracts and a lot of vendors, and we contracted with new actuaries. We didn't think it was appropriate to ask the new actuaries to present the work of a former contractor. So I'm going to do my best to really give a very high-level overview of OPEB. If there are questions on this, it's very likely I won't be able to answer them. However, I can take this back to the actuaries and get answers for the committee. But what is OPEB? So that's other post-employment benefits, and it considers the program's long-term liability. So this valuation is performed by PEB actuarial consultants. What they do is they value the cost to cover employees who no longer work for the state. So those are retirees who are receiving retiree benefits. Many states, and Nevada is one of them, have been moving away from offering retiree benefits. This is just a cost savings that employers, and not just public sector but private sector as well, they're not offering those retiree benefits. It's just a trend towards that because of the high cost of this type of benefit. So in Nevada, employees hired after December 31st of 2011 do not qualify for PEB retiree benefits. This is something that was determined by the legislature, and so this is, at some point, we will not be offering those retiree benefits moving forward. The OPEB is currently an unfunded liability, no assets. We have no assets to back it up. And the way that we're funding it is a pay-as-you-go. So this is built into our budget. There's what we call the REGI account, which is the retirees. And so this is a percentage of payroll. And agencies pay a percentage of payroll to fund their retiree benefits and moving forward. So it's a pay-as-you-go. We don't have a fund that is set aside to cover these benefits. This is why you'll hear throughout, you've probably heard it in this committee before and moving forward during legislative session. This is why it's so difficult to reinstate those retiree benefits after a decade of eliminating them, because you have a decade of unfunded liability. And so to reinstate that would be very difficult and require a lot of money, unfortunately. But we are a pay-as-you-go, and eventually that liability will decrease and become zero, because at some point everyone who is eligible for benefits, for retiree benefits, will have retired and passed on. And so there will only be folks that are hired after 2012 who do not qualify for those benefits. So that liability is slowly decreasing and will eventually one day become zero. So I'll stop there for questions.
Thank you very much. Questions?
So
Senator Stone.
Thank you, Madam Chair. Just to talk about the unfunded liability, did you say that the existing employees, even those that were employed after 12/31, I think 2011 you said. Existing employees are paying for the OPEB a contribution, but yet they're not going to be the beneficiaries to any retirement plan.
So technically, it's a percentage of, it's charged to the agencies, so it's a state. It's a state funded through the percentage of payroll that we receive from the state subsidy side. So it's not necessarily funded by the current active employees, it's funded by the state.
And what is the magnitude of the unfunded liability, let's say, in this fiscal year, and what do you project as a percentage that it's going to go down, and when do you think we'll get to net zero?
Good question, and I think that's an actuarial question that I may have to ask the subject matter experts on, but we will definitely give you that answer.
Thank you very much. Additional questions? Okay, seeing none, please proceed.
All right, Laura Rich for the record. This covers the biannual compliance review. Per statute, the program is required to conduct a biannual compliance review. And really what this covers is the program's compliance, legal compliance, with federal and state laws. And so we have our consultants, legal consultants, perform a biannual compliance review every 2 years, and they really take a look at where all of the new federal and state legislation that's been put into place, and if PEP is meeting those requirements. And I will tell you, when it comes to health insurance, there are a lot of requirements to stay on top of. There's a lot of noticing. There is a lot of just compliance in general. And so there were a few findings, and I'm just going to say I was actually fairly proud of the Public Employees Benefits Program, because given all of the new legislation and all of the COVID-related, changes that, I feel like they were just changing monthly and keeping up with all of the requirements of health plans. We did a pretty good job. The findings here were fairly minimal. There's a few significant ones, but I think that overall they were fairly minimal in terms of what came out of this audit. The big one was the Mental Health Parity and Addiction Equity Act. So what this is this act has been in place for several years. However, the requirement to there's been some added requirements for reporting and analysis and things like that that have been put into place within the last 2 years. That require health plans to provide federal reporting and analysis on on mental health parity. And so what this is the Mental Health Parity and Addiction Equity Act is basically an act that ensures that mental health benefits are being paid in parity with the other medical benefits that are covered through the health plan. Health plans, government health plans, self-funded plans are allowed to opt out of this. And so PEP has not opted out. We did not opt out, but we also did not comply with the federal reporting regulations that were put into place within the last 2 years of this act. So when this was discussed with the board, we agreed that because there's an inherent risk of not opting out, of really the default is opting in, it potentially puts you at risk with the feds, where you may end up having to undergo pretty significant and time-intensive audits as a result. And they are apparently taking action, with they're taking action. There's audits that are happening, fairly regularly, and so this is a risk. And so, as we discussed with the board or the program can opt out, but we can still continue to act as if we were opting in. So opting out allows us to remove that risk of federal audits and all of the administrative reporting and things like that that is required. But we can still continue with the analysis. We can still provide we can do the work to show that we are in compliance with that act without the risk of audits. And so the board did choose to opt out, but we will do the what's called the non-qualitative and the qualitative analysis that is required to ensure that we are in compliance with this act. So really, we're following the spirit of the law without having to put ourselves at risk if we don't. So the next one was the dental accepted benefit. An accepted benefit under the Affordable Care Act, there's some essential benefits. There's 10 essential benefits that are required under the Affordable Care Act. And one of those essential benefits is pediatric dental. So those children under the age of 19 are required to have pediatric dental coverage. And this is in a plan that is that has to adhere to ACA regulations. So typically, if there's situations where there's plans that are considered an accepted benefit, so an exception to the ACA, and in order to be an accepted benefit, it has to not be bundled into your medical. It has to be considered completely separate to your medical plan, and something either contractually or you have to enroll in it separately. And so that is how you can qualify a health service or a health plan such as dental to not have to comply with ACA 10 essential health benefits. Dental, as you may be aware, in the PEB program, it's bundled. It comes with, if you are enrolled in medical, you automatically get your dental coverage. And so as we were reviewing this, it's come up in a prior compliance audit in the past. I did a little bit of work because it was determined by our DAG in the past, or Deputy Attorney General, that it was an accepted benefit. And so nothing had been done in the past about it. But throughout discussions with legal, with our current Deputy Attorney General, we all decided and agreed that that the way that our dental plan is today, it is not an accepted benefit. And so we had the option of how do we comply with this? We can either make it an accepted benefit by unbundling it. This was going to be operationally a heavy lift because we would have to separate the premiums, we would have to allow people to enroll and to disenroll. And after all of the change the PEB has undergone, I think that would have been very, very disruptive to members. People would not have understood, and it would just be challenging and a cost as well to the program because we'd have to build the logic into the system. And so the board opted against this. An easier option was to just follow the ACA 10 essential health benefits. And so this was by adding, we just eliminated the annual maximum to, so we just changed it to $2,000 for the annual maximum for the dental benefit. But we removed it for children under 19. And so there is no annual maximum for children under 19 on our plan. And that puts us into compliance with the ACA. There's also non-discrimination testing that is required to be performed. So this is something that we are working with our vendors to put into place. There was a variety of suggested language edits to our master plan documents. So we're actively working with the subject matter experts in our clinical areas, and so our third-party administrator, our pharmacy benefit manager, and really just our legal consultants to make changes to the master plan documents and bring those back to the board in January for final approval so that they're ready to go by May open enrollment. And then the other significant one was the right to continuation of care. So we currently have NRS today that requires PEB and insurance plans to offer continuation of care if providers are, if they become out of network, due to contract or some type of situation where the member is in the middle of receiving care and that provider is no longer in network. And so there's, depending on the situation, there's a time frame to where a person can continue care through that provider at the in-network rate. So we already have a process for that that's in place today. However, there's a requirement now that requires the health plan to proactively identify members that meet this type of criteria. And while we do have a process in place to allow members to seek that continuation of care, to request it, it's not proactive. It requires a member asking for it and going through the process. We do not have a process in place to identify those folks proactively. So we're working with our TPA to ensure compliance on that. So those were the main, I think, the big ones. But like I said, all of these should be rectified here pretty shortly, through some small changes in the program.
Thank you very much. Questions from the committee? Assemblywoman Peters, please go ahead.
Thank you so much. I'm going to go back to my previous question related to the decision to opt out of the Mental Health Parity Act. First of all, I want to say this is one of the areas that I received the most complaints about from public employees, that the adequacy of coverage is just not meeting the need, particularly for kiddos. Children are one of our highest risk populations in the state of Nevada. We know this statistically, and we know this from experience in the state. And I, myself have mental and behavioral health issues that I deal with regularly. I really like the reporting. I think it's important for us to set a standard at the state that our parity metrics have a high, meet that high compliance. And if we don't set it at the state, then I don't know how we justify setting it for private industry. I'd like to just talk a little bit more about that decision and really the impact on actually, I guess I'd like to talk about how we can see how you're meeting those metrics without the opting in, right? Without remaining in that Mental Health Parity Act requirements. How will you ensure that we are seeing how PEB is meeting the mental health parity requirements without being in compliance with that law?
Laura Rich, for the record. Thank you for that. I'm happy to clarify. So we will be doing all of the reporting and all of the analysis that is required under this law and presenting it to the board. This is not something that we've opted out of. We are just opting out of the federal requirement, but we are still conducting all of the activities and reports that is required of that act, and those will be reported to the board. I would anticipate later in 2023. This is something it's going to be, I have yet to determine or to get the information on what it will take to do the analysis and how long it will take, but we're actively working with vendors to put that into place and to start that process, because I too believe it is very important. Mental health is, it's an area not just national, or not just statewide, but nationally, where we have provider shortages. But just in Nevada, it's a major problem. Mental health is a major problem. We do not have providers. This is not necessarily a network problem. It's really just a shortage of providers in general. I recently had, when we switched networks in July, I recently had 2 hospital systems call me directly and say, look, our behavioral health units, we have 100 of your patients and we're not in network. What do you want us to do? The first thing I did was call the network and say, what do you have to do to make this happen? I cannot, these 100 people do not have an alternative. There's nowhere that these people can go to. Especially, this was in northern Nevada. And so I had the network work with the provider to make it happen. Now, this comes at a cost, because obviously when they're contracting, when the network is contracting with this provider group, they're contracting at much higher prices than probably is the reimbursement rates than what is, I would say, the market rate, because they can, right? There's a provider shortage. And so in order to get these providers, and this is not just with mental health, but it's, in any area where you've got a shortage of providers and an increase in demand. And this is, I just actually spoke to the network yesterday about this in general, is that those contracted rates are increasing just overall. But I would assume, I don't have the numbers in front of me and don't have the data to justify this, but it's probably safe to assume that the contracted rates with mental health providers are increasing pretty rapidly. And again, it comes down to supply and demand. There's a low supply and a high demand. And so we are going to see mental health as a high cost in the plan. It's only going to go up. We did bring to the board an option to, we have a doctor on demand. It's a virtual healthcare option where you can seek not just medical care, but behavioral health services. We currently offer that in PEB today. You can seek a psychiatric or other kind of mental health services through the doctor on demand virtual product. And we had brought to the board, one of the decisions that they did not approve was lowering the copay on those as an incentive for folks to access virtual mental health. But these are all things that we're looking at, because I do agree mental health it's especially after the pandemic. It was an issue before the pandemic, but it's definitely going to be high on our radar, and really as a state, I think it should be as well.
I'm glad to hear you say that. I think that that's one of the things that is difficult to talk about in the capacity of healthcare is the economic impact of not treating mental and behavioral health care, and the effect it has on our economic system, right? People won't go to work, or they won't be productive. I know this myself if I'm not taking care of my mental health. So that cost burden is just, I think, generally shifted out of the economic cost burden and into the healthcare cost burdens, where it should be, right? So we're treating people where they need to be treated. I would ask, though, Ms. Rich, that you work with us to ensure that your compliance reporting is coming in. We asked the Division of Insurance to provide that information for the private insurance as well. And I'd love to be able to have those side by side and make sure that we're seeing the same kind of metrics being assessed across the board, especially as PEB is really the standard that we can set at this state for what our expectations are. So if you would be willing and able to provide that to us voluntarily, I would appreciate that as that reporting becomes available.
Thank you very much. And just as a follow-up to the Assemblywoman's comments, I too am concerned about this a little bit, and it's because where is this sort of written? In other words, while you're there, I feel good and I know you'll follow through, but so tomorrow you leave. Does the next person have this written somewhere where they actually follow this directive of opting out? And how do we help those people that at year end, when a vendor changes or a medication changes, we can't, it's not the same as an antibiotic where you can take one antibiotic or you can take another one. Mental health drugs are very specific and very important that the continuation of those things are done properly with doctor's care. So if you could just sort of address that a little bit, I'd appreciate it.
Sure. So Laura Rich, for the record, this was actually a board request that it would come to the board once the analysis was complete, that it would come to the board, and it is a yearly requirement federally to report this. So we would be doing it even though we have opted out. It's really, we're opting out of the federal requirement, but the PEB board still has that requirement. So we would add this on to one of the yearly type activities that has to happen. This is one of many that happen. And so we would just add this on as another item that gets done yearly, regardless of who is the executive officer at the time.
Thank you. Additional questions? Okay, seeing none.
Can I
Sure, absolutely. Go ahead.
Sorry. So I'm not tracking entirely the mandate piece. Ms. Rich, can you just walk us through how this will be documented as a mandate for the board into the future?
Laura Rich, for the record. So the board has requested that staff perform all of it's called the quantitative and non-quantitative testing that is, and I'm just going to add that I don't know the details to it quite yet. This happened, this board meeting was on December 5th, and so it was fairly recent, and the biannual compliance report was really wrapped up days before that. And so we're still getting through the details of what does that take and how long does it take. I know it's going to take several months to kind of go through it because it requires vendor coordination. And, what is the coverage for, again, it's parity between our medical benefit and our mental health benefits. I don't see it being problematic because just on the surface, we pay mental health it's the copay is a specialist visit copay, right? It's on the same, it's comparable to that. And so, but it gets into a lot more detail than that, obviously. So it's going to take several months to do and perform that analysis. The reporting is going to, we're going to follow the reporting just as if we had to report to the feds. That will be then presented to the board. I anticipate probably, I would say in the summer or maybe even early fall of 2023, just because we have 25 to 30+% vacancy rate depending on the day. So I don't have a lot of staff at the time, and we have a lot of implementations that need to happen. And on top of that, we have legislative session that is going to be, we're going to be dedicating a lot of our time to. And so we foresee this being presented to the board probably at either the July board meeting or possibly the September board meeting. I think it'll be performed and reported by then. And then it'll just be a regular agenda item on the PEB board schedule where this is reported. Again, we have to opt out yearly, so this is not something that just gets ignored and goes by the wayside. We have to actively opt out of this yearly. And so this is something that the board will have to actively approve and make a decision on yearly. So it will be reported on an annual basis to the board. It's just a matter of when do we get that started, and when is it, how long does it take from our vendors and our and staffing issues as well. And, you know, when we have staffing to be able to take on not just this, but we've got some RFPs as well. We have a lot of legislation that we're following right now. I think so far I have 110 BDRs that we are tracking just in a, you know, we're an agency of 34 people, and most of those are not staffed right now. So we're trying to prioritize it, knowing that legislative session is right around the corner. So trying to be realistic and saying that July is probably the most realistic timeframe to bring that back.
I certainly appreciate, I think all of us appreciate where you are commitment-wise and ensuring that you're meeting all of your obligations and standards with a lack of staff. You know, that doesn't dismiss our obligation to our constituents who are predominantly, well, who all of our state employees are constituents and one of ours or another, right? Or most of them at least. So we do have that burden to adhere to. But I just want to synthesize this. It is not something that will be mandated, that will be put into writing anywhere. This is something that will annually be addressed by the PEB board and be requested by the PEB board. And if it's not requested by the PEB board within the context of opting out of the federal reporting, then it wouldn't have to be reported in by PEB staff.
Correct. And another idea is we can add this to the information that we present to IRBC, whether it's in the utilization report or maybe even a separate agenda item. We are happy to bring that back yearly to IRBC as well.
Thank you.
Thank you very much. All right. Well, seeing no more questions, we appreciate your time and expertise with all this information. I'm sure that if there are any additional questions, somebody will know where to find you. And we thank you very much.
Thank you.
Next, we will go to agenda item 5, Public Employees Retirement System, Judicial Retirement System, and Legislators Retirement System. Here with us today, we have Tina Leese, Executive Officer of the Public Employees Retirement System of Nevada. And Ms. Leese, when you join us, if you'll introduce who you have with you today, and we'll get ourselves organized up on this end. And when you're ready, please go ahead.
Good morning, Madam Chair. If you're ready, we are ready to go, I believe.
Please go ahead.
Thank you. I am Tina Liss. I am the Executive Officer of the Public Employees Retirement System. Here with me today, to my left, is Steve Edmondson. He's our Chief Investment Officer. And Cabrina Fazer is our Operations Officer. They will both be testifying on later agenda items. Also in Carson City, we have Rick Combs, who will be testifying on the agenda item 5.6, which is the Retirement Benefits Investment Board, which has to do with a separate fund for local governments. And with that, I will start off with item 5.1, which is the actuarial valuation for the Public Employees Retirement System. And just before I begin, I will give just a brief update on the system itself, since we do have a new member. The Public Employees Retirement System covers all public employers in the state of Nevada. So that includes all city, county, state, and school districts. Our largest employer is the Clark County School District, and our second largest employer is the state of Nevada. The state of Nevada, when you include the Nevada system of higher education, is a little under 20% of the fund itself. All of our employers and employees participate in our plan equally. That is, we are a cost-sharing plan so that the benefit provisions and the contribution rates are the same across all employers. So that allows our employees to move freely between public employers without any difference in their benefit structure or their contribution rates. The first item is the actuarial evaluation for 2022. The actuarial evaluations determine the projected liabilities of the plan and the contribution rates needed to fund the plan on an actuarial reserve system. And during this process, the actuary considers the plan design, our member demographics, and our economic assumptions to come up with the evaluation of the system. Now, pursuant to the Nevada Constitution, the system is governed by the Retirement Board, and also pursuant to the Constitution, the Retirement Board must adopt the actuarial assumptions that are recommended by the actuary. So, therefore, if the actuary recommends an assumption, the Retirement Board is legally required to adopt those assumptions when the actuary prepares the valuation. And then by statute, the contribution rates are set based on that actuarial rate developed by the actuary. So this is legally essentially an automatic process by which the actuary does the valuation, and then the statute determines then what those contribution rates will be based on that valuation. So the contribution rates must change pursuant to the statute with the first full reporting period on or after July 1st of each odd numbered year. So the 2022 valuation determines what the rates will be beginning July 1st, 2023. Now, the ultimate cost of the benefits to be paid by the system are determined by the plan design, which is set by the legislature, and future events such as the length of service, average compensation, and longevity of our members. The goal of the actuarial funding is to ensure that the current and future benefits are paid through appropriate levels of employer and employee contributions and the investment earnings on those contributions. To project the liabilities, we make assumptions about future events. Of course, since they are future events, we don't always know what that will be. The actuary makes those assumptions, and then in the valuation process, then looks at how our experience compared to that assumption. So you will then get a gain or a loss based on how we did against the assumption. Obviously, your big assumptions are going to be your investment return. Did we make more or less than that long-term rate of investment? Did our members live longer than we assumed they were going to live, or did we have more deaths than we were expecting? Did our members have higher salaries than we were expecting? Did they have lower salaries than we were expecting? Did we have higher payroll or lower payroll? We look at all of those factors to determine then what we value the system for that 2-year period for the contribution rates. Now, to make sure that those assumptions are tracking with our experience, we do an experience study every 4 to 6 years. We reported last year, the 2021 valuation did include the changed assumptions from our last experience study in 2021. However, 2021 was not a rate-setting valuation. So this is the first valuation where our new assumptions based on the 2021 experience study have been put into place and then feed into the contribution rates. The demographic assumptions that we changed for the experience study included, the biggest one was probably the mortality tables. So the longevity of our members, we've moved to a fully generational mortality table, which takes into account future expected growth in longevity or changes in longevity. And so when you assume people are going to live longer, then you also know that you're paying the benefit longer than you previously were expecting to. So any changes to the mortality table in that way will increase your costs and will increase the unfunded liability. The assumed rate of investment return was also changed from 7.5% to 7.25%. That is a long-term assumption. We obviously don't anticipate that we will make 7.25% each and every year, but over the long-term average is what you would expect for that long-term rate of assumption. The other probably biggest change for the experience study was the payroll growth assumption. The regular fund had a payroll growth assumption of 5.5%, and that was changed to 3.5% annual growth per year. And then the police fire fund had a change from a 6.5% payroll growth assumption to a 3.5% payroll growth assumption. Where this assumption is important is in paying off your unfunded liability. Our contributions are a percentage of payroll. And so when the actuary determines the amount of contributions that need to be made, they develop that in a lump sum amount and then convert it back to a percentage of payroll. So if you have a lower payroll than you thought you were going to have and your payments are being made as a percentage of payroll, then you ultimately are getting in lower contributions than you were assuming. So when we lower the assumed payroll growth assumption to pay for the unfunded liability, then that translates to needing a higher percentage of the payroll that you do have, because the payroll isn't growing as much as you assumed that it would. And just as a side note, on the payroll growth assumption, this is something that we had been watching since 2008. Prior to 2008, the state of Nevada had extremely high payroll growth in public employment. We essentially were always the top in the nation as far as payroll growth in our public employment, which is kind of interesting because we historically have had probably the lowest number of public employees per capita. We always rank fairly low. I haven't looked at that number the last couple of years, but we rank fairly low in the number of public employees per capita when you combined all state and local government employees across the nation. But what we did have, because we were a very fast-growing state, our population was growing by quite a bit, that through the 70s, the 80s, the 90s, and the early 2000s, we had very high payroll growth. And when you have high payroll growth and you have a percentage of your contributions are coming in as a percentage of payroll, and you have a higher payroll growth than you assumed, then you're getting more contributions in. In 2008 and 9, that hit a very big reversal in the state of Nevada. And so we ended up years with negative payroll growth, and so your contributions are coming in lower. We were hesitant to make any long-term changes to the payroll growth right after the 08-09 timeframe. But by the time of 2021, when the payroll growth had not come back in the state, the actuary determined that they really needed to make that change, because this is looking more like a long-term trend for us versus just a shorter-term issue that was going to be worked through. And as I said, so the modifications to the assumptions can have increasing or decreasing effects on contribution rates. In our case, with these assumption changes in 2021, they had primarily increasing effects to the contribution rates. And you will see that as we get farther into this presentation. So that is kind of the experience study and kind of sets you up for what you will see for the contribution rates. But before we get to that, I just want to comment just briefly on charts 328 and 329 in your packet. You will see the changes to our active membership. This is also some interesting numbers for us. The 2022 valuation shows an overall increase in active members from 106,930 to 108,635. However, that was not equal between our two funds, the regular and the police fire fund. The police fire fund had a decrease of 284 active members. So the police fire fund is just under 13,000 members now, and they had a decrease of 284 to get to that point. So it's a much smaller fund than the regular fund, but they did have that decrease in membership where the membership in the regular fund increase. This will be something we will need to continually look at again for the payroll growth in the future. Now the charts on page 330 and 331 contain information on the retiree membership and the average benefits. These have grown pretty much as we would anticipate in the last year, and so there was not a lot of big change there. The charts on page 332 and 333 show the actuarially calculated contribution rates for 2022. Now, these rates reflect both our asset smoothing. We have a 5-year asset smoothing and also a rate impact smoothing that we did with the assumption changes. So when the actuary did the 2021 experience study, they recommended that the board smooth the impact of those changes because those changes were significant. And so these rates reflect half of the impact of the smoothing. And you will see that the current statutory rate in the regular fund is 29.75% of payroll. The actuarial rate came in at 33.61. With the statutory rounding mechanism, that gives a increase to the rate of 33.5%. This is the employer pay rate. Now, that is somewhat of a misleading name. It is called employer pay because we do collect the entire contribution from the employer, and about 80% of our membership does participate in the employer pay plan. Most local governments only offer the employer pay plan and legally can only offer the employer pay plan, but this is equally shared between the member and the employer. So what will happen is that when there's a rate increase, in this case it's 3.75%, the employer must certify to us how the employee is sharing in their half of this rate. So what the employer can tell us is that they are going to reduce the employee's salary for half of that contribution rate increase, which is historically what the state has done with its employees. Or the employer can tell us that they were going to give their employees an equivalent pay increase, and instead of that pay increase, it is now going to pay for the employee's portion of the contribution rate increase. This is historically how local governments will implement the contribution rate increase. Each employer can make that decision going forward with each rate increase. So if an employer chose to reduce the employee's salary last time, they can choose to do the in lieu of mechanism in the statute or vice versa. But historically, the state does the straight up reduction of salary, and historically local governments will do the in lieu of mechanism. Let's see. Oh, sorry, I skipped over the police fire entirely, which I did not mean to do. So also on page 332 is the police fire rate. You will see that their actuarial rate, their current statutory rate is 44%. Their actuarial rate came in at 49.95, which then gave a statutory rate of 50%. This is an increase of 6%, 6 percentage points to this fund. The causes to the contribution rate increases for the police fire fund are similar to the regular side, but they're magnified, and that's because the smaller size of this fund, so it makes it more volatile when you have fewer members to spread changes over. Certain changes to certain assumptions also have a greater impact on the police fire side. The main distinguishing factor between the regular benefit provisions and the police fire benefit provisions are that the police fire fund has earlier retirement. A police fire member can retire at age 50 with 20 years of service. A regular member can retire at age 60 with 10 years of service. So you typically have maybe a 10-year difference of when the police fire members can retire and when the regular members can retire. And if you're drawing the benefit for 10 years longer, then that will obviously greatly increase the cost of that benefit. Also with the mortality tables are very similar between the two funds. So drawing 10 years earlier generally will mean that they will also be drawing 10 years longer. And that is what makes that benefit significantly more expensive on the contribution rate. The next page, 333, gives you the employer pay fund. This fund is where the employer pays half of the rate directly to us. The employees pay half of the rate. The employee share is done as an after-tax deduction so that their contributions are then refundable. And because of those refundable employee contributions, it makes this rate about 1 to 1.5% higher historically. Only about 20% of our members participate under this program. It is a choice of the member to do either the employer pay or the employer pay if they are with an agency that can allow that. Most of your employees on this fund are state employees because that is the largest employer that is legally able to offer this plan. An employee on the employee employer pay plan can switch to the employer pay plan. Once an employee makes a voluntary switch, they must stay in employer pay. Now, page 334 really gets to the heart of why these rates have changed. So what we have done with this chart with the actuary is give you the rates from 2 years ago. So we do an actuarial evaluation every year, but the rates only change every 2 years. And so we went back to the previous rate setting year of 2020 to give you the rate on top. And these are the average rates between the two contribution rate plans, so they won't completely match with either the employer pay plan or the other plan because the actuary averaged the two as a weighted average. And then took it to the bottom of 2022 to show the rate changes. And anything in parentheses on this page is a reduction to the rate, and anything not in parentheses was an increase to the rate. So you will see that even though our fiscal year market investment return was less than our assumed return, and Steve will get into that in his presentation, our 5-year smoothing of assets actually gave us an investment gain for the year. So the investment gain over the 2-year period actually worked to reduce the contribution rate in the regular fund by 2.36%. If you go down, you will see that the biggest impacts to the increase are, number one, the effect of the payroll growth being lower than assumed, meaning we're not getting contribution rates in at the level that we would assume, and you will also see that a little further down, 0.88% and 1.04%. The other thing I wanted to really note on here, almost 2% of the rate for the regular side and almost 3% of the rate on the police fire side in the increase is due to our post-retirement benefit increases being greater than we assumed them to be. We have a long-term assumption for inflation of 2.5%. And as you're probably aware that inflation's been a little bit higher than 2.5% in the last year or so. And so our post-retirement increases are capped by the rate of inflation. And since inflation has generally been higher than our statutory percentages, that means we're paying higher post-retirement increases to our retirees, which then has led us to a significant loss in the last 2 years, leading to a significant portion of the contribution rate increase. Now, I will like to say that that is part of the benefit design the legislature has determined is necessary because it is now working as designed to allow our retirees to keep pace with inflation. And these are post-retirement benefit increases are paid for through the contribution rate. That's why you're seeing it feed to the contribution rate. Prior to the high inflationary environment, we had gains in this area. So now we're kind of trading off and kind of equalizing that, but right now those are a large impact, a large driver on the rates. If you get further down on the regular side, the effect of the changes in the assumptions were 7.92%. That's primarily going to be from the payroll growth assumption change, the change in mortality table, and also a change into retirement rates. We historically, the last 10 years or so, have been running losses in rates of retirements, which means that people were retiring earlier and more expensively than we were assuming. And so we made changes to the assumption, which then changed the rate going forward. You'll also see there that there is the effect of our phase-in of the rates, and then the bottom line, you will see effective changes in funding policy. The Retirement Board, at the recommendation of the actuary, made a change to the funding policy on the amortization of the unfunded liability. We were getting to a fairly short time period in the amortization of the unfunded liability. The shorter the time period, the more volatile it gets, because you have now a shorter time period. And so the board made a change in the regular side, made a change that would take the biggest layer of the unfunded liability and leave it on its same time schedule. But because of the changes to the assumptions and that the effect that that had on the rate, it was determined that it was sound funding policy to then put the rest of the unfunded liability on a 20-year payment schedule, which had an impact of decreasing the ultimate rate by 1.5% on the regular side. What they did on the police fire side is put the entire unfunded on a 20-year payment, which is recommended by the actuary because of the smaller size of that fund. When they were getting when you had the amortization period getting too short, it was getting too volatile. And so putting them back on their 20, they are a closed layer approach, so that will decrease a year. Each year, it will decrease by a year. That saved about 6% on the contribution rate for the police fire side. So those were the two changes that the board made, was to the funding policy. And that is, so this chart then shows all the causes and of the rate changes, and then also it does show the effect of the methods the board put into place to try to take away some of the volatility of the contribution rates. So with this change to the amortization period, the effective amortization period for the regular fund is 16.5 years, and for the police fire fund, it's 20 years. For an aggregate of 17.3. So right now we are on a 17.3 amortization period, which really industry-wide is a very good amortization time period to be on. When you get much above 25 is where the actuaries really will start getting concerned with you. But as I said, being at 17.3, the board's really happy with that result. On page 335, there's information on the funded ratio of the system. The funded ratio is based on the actuarial value of assets versus the actuarial liabilities. The actuarial value of assets is used for funding purposes because it smooths the 5 years of investment gains and losses in order to reduce the volatility. The actuarial funded ratio for the regular fund decreased slightly from 75.3 to 74.8. And the police fire funded ratio decreased from 75.6 to 74.6. This has mainly to do with the assumption changes. Again, when you make changes primarily to the payroll growth and not the payroll growth, the mortality tables, that will have an effect on your unfunded liability number. The combined actuarial funded ratio is 74.7, which is down from 75.4. Now, page 336 shows information regarding the actuarial value of assets versus the actuarial liabilities. This is just to give you a representation of the growth of the assets versus the growth of the unfunded liability over a 10-year period. And right now, our actuarial value of assets and our market value of assets are pretty close on. We do have a small unrecognized investment gain that will be recognized over the next 3 years. So with that, I would be happy to answer any questions on the PERS actuarial valuation.
Thank you very much. I believe Chair Monroe Moreno has a question.
Thank you. And thank you for the presentation. You've covered a lot of the primary factors that will require the increase of the contribution. And I may have missed it, and if I did, I apologize. Were there other options that were discussed with the PERS board to offset the increases to those contribution rates? And if so, could you share what those other options were with us?
Under the way our legal provisions work and the funding policy, there really weren't a lot of other options for the board because of the Constitution, which requires the board to adopt the actuarial assumptions recommended by the actuary. Those are the assumptions that have to be used, and the reason for that is to make sure that you are realistically funding your plan. And then the other part of that is because the statute requires that the contribution rates be set based on the actuarial valuation results. There's really not a lot the board, really discretion the board has in the setting of the contribution rates. Where the board has some discretion, and this always comes on the advice of the actuary, is in the funding policy itself. And so with that, the two areas where they went is with the phase-in of the changes based on the changes to the actuarial assumptions. And then the other thing was lengthening the time period by which we're paying the unfunded liability. Those were really the only two options that the board discussed. There are obviously options that the legislature has because the legislature historically by statute has controlled how the contribution rate mechanism is established, and that includes the split between the employer and the employee. We are somewhat unique in Nevada in the fact that the employer and employee split the rate in half, including the payment on the unfunded liability, and so those would be areas that would be left to the legislature.
You said we're unusual when we split it in half. What's the custom with other states? Is there a different mechanism used, and could you share with us what that is?
Sure, Tina List for the record. There are primarily two ways that other states may do. Some are fully non-contributory, which would mean the employer pays the entire rate. That is not all that common. The most common method, I would say, is probably where the employee portion of the rate is set in statute as a certain percentage, and then the employer contribution rate is what will float based on the actuarial results. And I also will say there are a number of states who just have a statutory rate that sets it as a certain percentage of payroll. The concern with that would be that you may not always be paying the rate that the actuary believes is necessary to fund your plan, and so you could get a little concerned if you had a set statutory rate in total, but it would depend on obviously what the rate is set at. But I would say the most common is to set the employee rate at a certain percentage, and then the employer pays the rest of the rate.
Thank you.
Thank you very much. Additional questions? Senator Orenshaw, please.
Thank you very much, Chair Dondera Loop. One question I have, and I'm looking at page 334, the chart that talks about the change in actuarially determined contribution rates. The third item talks about the effect on existing amortization of payroll growth, less than expected. And I'm wondering, is that just because contributing members' payrolls didn't grow like they did in the past, or is part of that due to the vacancy that we've heard about, vacancies in different state and local government employers?
Tina List for the record. That's going to be a combination of both. So that's based on total payroll. So it's going to be affected by the salaries that are being paid and by how many active members you have. And so our total payroll was growing and sometimes was negative or growing less than we assumed. And since we pay as a percentage of payroll, that means we're getting lower dollars in on contributions than we thought. And our unfunded payments are based on that. And so we're not getting it in. So it has two factors. But the main one is the fact that our active membership either some years has decreased or has not increased by much. So it has probably more to do with the number of active members, which has to do with vacancies. In prior years, it had to do with potentially, layoffs or other things that governments had to do if they had budgetary issues. But yes, vacancies would have a big effect on that.
Thank you very much, Ms. Liss. And Chair, may I indulge me one further question? Thank you. The contribution smoothing mechanism that the PERS board has put in, do you think that these projected increases would be worse if that weren't in there, or how do you think that's affecting that smoothing mechanism, what the employees are going to be needing to contribute?
So what the board put in place, the smoothing of the phase-in of the actuarial assumption changes, definitely decreased the current contribution rate increases. The point was to not put it in all at once. Those will need to come in at some point. Currently, the phase-in period, it was a 4-year phase-in period. So the way it stands now is the rest of that will phase in over the next 2 years. So essentially that means the next rate setting mechanism 2 years from now in 2025, combined with whatever experience we have in the time period. So those will come in. What the board did with the change to the amortization period, that will, I guess, permanently lower what the rate would have been, if that makes sense, because you're spreading the time out over a long period of time. So the numbers that you see on this page, the effective changes in the funding policy, we don't expect that to come back in the next 4 to 6 to 8 years as far as contribution rates, but you would affect the line above it, effect of the 4-year phase-in. That will be phased in probably by the next valuation, not the next rate-setting valuation. I'm not sure if I fully answered your question.
Thank you. Thank you, Ms. Liss. Thank you, Chair.
Thank you very much. Additional questions from anybody at the committee? Assemblywoman Peters, are you raising your hand or? Okay, thank you. All right, I just have one question. It's just clarification. We've had the conversation, but I just need to, I guess, hear it again. The 12 participating entities in that RBIF, they're not all, like all the people that we assume should be there are not all there on that list. And so I was wondering if you could clarify why, like, say we don't see North Las Vegas, or we don't see Clark County School District, or some of those other entities that may very well be participating.
Tina Liss for the record. And there is a later agenda item on RBIF if you want to wait for there, or I believe Rick Combs just moved to the table if you want him to answer that now.
No, we can wait. Thank you. I was jumping ahead.
The next item on the agenda is the Judicial Retirement System Actuarial Valuation. And Tina Liss, again, Executive Officer of the Public Employees Retirement System. So the PERS and the PERS Board is also tasked with the administration of the Judicial Retirement System. And as you may remember, this prior to 2001 was what we would have called a pay-as-you-go, or what happened was that the judges were not in PERS unless they were prior PERS members. And then they would have in statute just a benefit that was promised to them, and then the legislature each session would have to fund the benefits being paid out. So there were no contributions made, no investments. And in 2001, the Judicial Retirement System was created, and it was funded with, and I think an initial payment of $5 million in July of 2001. And what happened was all the judges that the state was paying on a pay-as-you-go basis were folded into the judicial retirement system. So that system started with paying out benefits to people who had we'd never had contributions for. So that's just a little bit of an explanation of why this system was created initially with an unfunded liability, and it was created just for the state. So at that point, it was just your Supreme Court justices and district court judges at that time. And then the legislature, I believe in around 2007, allowed for local jurisdictions to opt to elect to cover their justices of the peace and municipal court judges. And because of the way that the judicial retirement system was created, that was done in a way to have it so this is not a cost-sharing plan. So in other words, we do, the actuary does essentially a mini valuation, one for the state and one for each local government employer. And so each local government employer that has opted to participate has its own contribution rate. Now, similar to PERS, they have a mechanism where their rates will change every 2 years based on the actuarial valuation. And we do look at it in an aggregate, and we do look at it individually, employer by employer. The actuarial contribution rate, and this is a little bit different than PERS for state judges, is currently 22.0%. That is only what we call normal costs and administrative costs. That does not include a payment on the unfunded liability. So for PERS, the payment on the unfunded liability is included in the total contribution rate that we just talked about, the 33.75%. But for the state judges, we get a lump sum payment each year to pay the unfunded liability payment. So the 22% is covering what is going forward, and then we get a lump sum for the unfunded liability payment. The state judges rate came in at 23.33%. They had the same assumption changes as the PERS fund, or very similar assumption changes. They're demographically a very different group, as you might imagine, than your general employees in PERS, just because they tend to come to the judicial retirement system. They tend to come to the bench a little bit older than your general employees. And so they have a little bit different demographics. So their rate rounded will move from 22% to 23.25%. Now the amortization payment is paid directly to us from AOC, and it is once a year in July. That payment is going to be $1,551,796 each year in the biennium. That is up from $1,322,137 in the current biennium. The ratio of actuarial value of assets to liability in this fund actually increased from 92 to 92.2%. And the unfunded actuarial liability increased from $14.2 million to $14.7. Now this is on aggregate. Pages 339 to 344 contain demographic information for the both state and non-state members. 342 contains the contribution rates I just went over for the state judges. And then 343 and 344 contain contribution rate information for the local jurisdictions. You'll see there is a large variation in contribution rates for the local jurisdictions because they in general cover a very small number of people. Some local jurisdictions may only have one active member, some have 0 active members at this point, some have retirees, some do not have retirees. But for the most part, the local governments, just the way that they were developed without an unfunded liability in the first place, so they are for the most part over 100% funded on an individual basis. And that concludes my prepared remarks for the judicial retirement system, and I'd be happy to answer any questions.
Thank you very much. Questions from anyone on the committee? Okay, seeing none, we can move on.
The next item, 5.3, starting on page 345, is the update for the legislator's retirement system. As you may recall, the provisions of the legislative retirement system allow legislators to either opt out or terminate participation. So one would be they never became a member, and one was they were a member and elected to terminate. In 2022, the active membership in this fund decreased from 27 to 25 members. The number of retirees decreased from 55 to 53, while the number of overall beneficiaries, which includes survivors, decreased from 70 to 69. Like PERS and JRS, the even numbered fiscal year valuation for LRS determines the amount of the lump sum contribution made by the employer, in this case the legislature, for each year of the biennium. And by statute, the participating legislators contribute 15% of legislative pay as the employee contribution, so a little bit different than PERS and judicial retirement system. And then the employer, which the state, as this is a one employer plan, pays whatever then is determined by the actuary above that 15% needed to fund the plan. So in this valuation, the employer payment is increasing from $82,846 in the prior biennium to $90,579 in the current biennium. So that will be each year of the upcoming biennium. The assumptions changes were also made to the legislative retirement system, and so that is the main reason for that payment to be increasing. The funded ratio of the legislator's retirement system decreased from 98.8% to 97.6%, so nearly 100% funded. The the unfunded actuarial liability is somewhat volatile in this fund just because of the small size and the very short amortization period that this fund has. It increased over the last year from $61,732 to $124,363, but by comparison, 2 years ago, it was $199,000. So over the 2-year period, the unfunded liability decreased from $199,433 to $124,363. The demographic information for this plan is on page 346 of your packet. The amortization period for this fund is only 1.7 years. So that's the length of time that is estimated for this fund to be 100% funded, which I think is important for this fund because of the active membership dropping because of the opt-out or the termination features of this plan. And I will also note that the maximum benefit in this plan can no longer be achieved by any individual member because of term limits. It would take 30 years of legislative service to achieve the maximum benefit, and I do not believe that is possible any longer. And that concludes my remarks on the legislator's retirement system, and I'd be happy to answer any questions.
Any questions? Okay, you made it crystal clear. We have term limits. Thank you very much. Please move on.
Yes, Madam Chair, members of the committee, my name is Steve Edmondson, Chief Investment Officer of Nevada PERS. My portion of today's report is going to cover the status of the investment program for the PERS legislators and judicial funds. Beginning on page, I believe, 351 of the provided materials, there's a page titled Investment Results. This page summarizes performance for all three funds through the 2022 fiscal year. The column furthest on the left depicts returns for the most recent fiscal year. Nevada PERS experienced a return of negative 5.2%. Obviously a difficult year for investments. And however, it's one of those things that is not necessarily totally unexpected. This represents the 5th negative fiscal year in PERS history. And throughout that history, the 38 years since inception, Nevada PERS investor return has achieved its long-term objective, but over any individual year, we certainly expect a lot of volatility around those returns. And in fact, looking at the 3, 5, 10, and 30-year numbers for Nevada PERS, each one of those numbers returns is above PERS longer-term return assumption. And I'll note the middle year, the middle column, the 5-year number is often an important one for the valuation, which Tina was referencing earlier today, in that the actuary utilizes a 5-year smoothing period for investment returns. So when that number is above our long-term return assumption, that will generally imply that we're rolling some investment gains into the valuations. The legislators and judicial portfolios return negative 9.5 for the fiscal year. The legislature's portfolio ended the period with $4.8 million in assets, and the judicial fund ended the period with $163.7 million in assets. You'll note the return differences between the large PERS fund and the smaller legislators and judicial portfolios. That difference is largely due to the fact that the smaller portfolios don't have private market exposures in them. So the larger Nevada PERS fund has allocations to both private equity and private real estate. Those returns tend to lag public markets to some degree, and in single years you'll see some return differences, but over longer time horizons, the risk profiles of those smaller portfolios are designed to be roughly in line with Nevada PERS. So over extended time periods, we expect to see those returns come closer together, and we're starting to see that in the current fiscal year. Last fiscal year, private markets were somewhat of a tailwind for the larger PERS portfolio. It wouldn't be surprising to see that phenomenon flip a little bit this next year and have the smaller legislators and judicial funds perhaps outpace the larger PERS portfolio in the coming fiscal year. The following page 352, titled PERS Annual Performance, details PERS investment returns for each of the last 38 fiscal years. The horizontal line across the middle of the page depicts Nevada PERS long-term investment return assumption, which Tina noted was reduced by the board at the recommendation of the actuary. That's one of the actuarial assumptions that the board adopts, and it was reduced from 7.5 down to 7.25. Looking back over the past 38 years, one of the things that's really important to note is that we certainly don't expect any single year to be right at 7.25. In single years, we expect a wide dispersion of returns around that. The last couple years are a pretty good example of that. The 2021 fiscal year return for PERS was north of 27%. Last year, negative 5%. This dispersion in single year returns is something that we expect to see over time. And there's going to certainly be years that we're below that 7.25% long-term assumption. Over the last 38 years, 12 of those years were below that number. We would expect this type of performance both above and below that line to continue out into the future. PERS investment strategy is depicted on page 355, I believe, of the provided materials. And PERS investment strategy is somewhat unique in the industry in that we employ a much simpler portfolio design with a larger allocation of high-quality publicly traded stocks and bonds. And we, at least to my knowledge, are the only large public pension fund that is 100% indexed across all public markets. So all publicly traded U.S. stocks, international stocks, and U.S. bonds are all indexed, which keeps our costs low. At the end of the day, I think that there's a number of advantages of our simple structure at Nevada PERS. Again, not the least of which are minimizing investment costs. We certainly don't know what the future holds for markets every year, but we do know that we can control costs. And so we've put a heavy emphasis on that over the years. Nevada PERS investment costs are among the lowest, if not the lowest, amongst our peer group of large public pension funds, which we estimate saves the system north of $200 million per year in savings due to the lower fee structure. In addition to being low cost, though, the simple portfolio design that we've put together here at Nevada PERS has also proven to be competitive over time. Over the last 3, 5, 7, and 10-year time periods, Nevada PERS investment returns rank within the top 10th percentile or better amongst our large public fund peer group. And over the last 38 years, or since the fund's inception, Nevada PERS returns ranks within the top 15th percentile of large public pension funds. So it's been low cost, but it's also been competitive relative to more complicated portfolio designs that you see out there in the public fund space. We, I guess similar to single year returns, we don't expect our rankings will be at the top of the peer group every year, and when in fact we spend about a third of any individual years towards the bottom end of the database, but over time we do believe that PERS simple low-cost approach will continue to be competitive relative to more complicated portfolios over time. So while my report today and the provided material are all through the most recent fiscal year end, I wanted to take the opportunity to provide a quick update on where we stand in the 2023 fiscal year. As of this morning, Nevada PERS portfolio is up approximately 3.5% fiscal year to date, with around $55.7 billion in total fund assets. Thus far, this fiscal year has proven to be very volatile. At one point in the month of July, PERS total portfolio was up 7% fiscal year to date. We finished the September quarter negative 5.2. Over the first quarter, and here we are today, we're up 3.5% fiscal year to date. Where we'll end the fiscal year is certainly anyone's guess, but I think, given the Federal Reserve's current aggressive rate tightening regime to bring inflation down, additional volatility throughout the rest of the year wouldn't be surprising. However, amongst kind of the market volatility that we've been witnessing over the last 12 to 18 months, there are some silver linings that have appeared specifically for public pension funds. Really, the thing that's been making waves across markets recently has been the dramatic increase in interest rates. In March 2020, 10-year Treasury bonds were trading at 50 basis points, so the yield on the 10-year Treasury bond was 50 basis points, or 0.5%. Today, they've been hovering around 3.5%. They were actually above 4% earlier in the fiscal year. But the higher yield for fixed income securities portends a much stronger foundation for future returns for public pension funds. It will be the more normalized interest rate environment is a much better and stronger foundation for prospective returns than when rates were at historic lows. And that concludes my prepared remarks.
Thank you very much. Questions from the committee? Questions online? Anybody there? No? Okay. All right. Oh, Senator Stone, please go ahead.
Yeah, thank you for your presentation. Thank you, Madam Chair. And I can imagine the stress that you have to endure with the market fluctuations that we've certainly seen in the past 12 months. But with the prediction of, I think that they raised interest rates again today, and the market's certainly seeing a reflection that's over 300 points down today. And the prospects of a potential recession, is that going to change your investment strategies as we come into 2023?
Yes, Senator, thank you for the question again. Steve Edmondson, Chief Investment Officer, Nevada PERS. In short, that will not change our long-term approach here at Nevada PERS. We do try to maintain a long time horizon, but I think that the situation that you just pointed to, obviously the Fed today raising rates again, where the terminal rate will be and when the Fed ultimately stops, whether or not there's a soft landing or we ultimately experience a recession, will certainly impact Nevada PERS return for the current fiscal year and probably the coming years as well. However, one of the things that we try to do at Nevada PERS, there's basically two things that we know we can control. We control our fees, so we keep our fees low. The other thing that we can do is maintain a disciplined approach throughout the market cycle. So that's one of the things that we've been able to do, I think, to a high degree of success within our investment portfolio, is that we haven't changed our approach throughout the market cycle. We've done this through the dot-com run-up and burst back in the late 90s, early 2000s throughout the financial crisis. And we will continue to deploy that same disciplined approach in the current environment. One of the things that we do have available to us, and it's one of the benefits of our simple structure, is that we have a lot of liquidity in the portfolio, and so we adhere to a really disciplined rebalancing process, which has the natural effect of rebalancing into risk assets after they've sold off and rebalancing out of risky assets like stocks after they've experienced a big run-up. So the most recent example of that would be we sold roughly 5% in equities back in the fall of 2021. We rebalanced back into equities in June of 2022. We'll continue to deploy an approach like that. It's a mechanical, rules-based approach that we follow. But the liquidity in our portfolio and the high degree of liquidity in our portfolio makes that an option for us, and it makes it relatively easy for us to do. So there might be some rebalancing, but from a long-term, I guess, strategic perspective, we don't anticipate, at least at this time, making any changes.
If I can follow up, are there any thresholds that would require you to alert the legislature in the event that the market continues a downward slide, where our percentage of funding, if you will, our unfunded liability increases to a point where it becomes a factor that the legislature should know? And in my prior experience in another state legislature, which had a much larger fund than Nevada's fund, there were many instances where the state had to actually take general fund money and put it into the pension system because it fell below certain thresholds. Has that been an issue in Nevada as a newcomer? Has the state had to supplant the pension fund to make sure that our unfunded liability doesn't fall below a certain threshold level?
Tina List for the record. That has never happened in Nevada. We part of our approach and part of where we are a little bit different is, our contribution rates are based on the actuarial valuation, so that we tend to always make the contributions we're supposed to make, and that's not always true of other states. A lot of times they have that statutory rate that doesn't necessarily pay the rate. The other thing about Nevada is we're in our 75th year, but I call us a bit of a young fund in the sense that we went cash flow negative, so to speak, from the perspective of contributions to benefits much later than a lot of funds, and we are much less so cash flow negative. And as Steve said, we're fairly liquid. So we have never had that kind of event happen for us. We don't have any legal thresholds by which we report. We do report to IRBC, but we've also never been, I would say, anywhere close to any type of situation like that.
I'll just end by saying I want to compliment you. If you're only at a 5.2% decrease in the year 2022, your investment strategies have been pretty robust and pretty conservative, because certainly the private sector that's been involved in the market has seen much larger losses than the state has. So I wanted to thank you for your astute protection of the public funds. Thank you, Madam Chair.
Thank you very much. Okay, not seeing any other questions, we'll move on. Thank you.
Thank you, Madam Chair. Tina List for the record. Item 5.5 in your packet on page 357 is an update on the benefit provided to certain educational employees pursuant to NRS 391.165. This is a benefit that was put in place by the legislature as an incentive for certain employees to work at schools that have been designated at needs or as needs improvements, or at least 65% of the pupils are children who are at risk. Additionally, this benefit was available to any teacher who holds an endorsement in mathematics, science, special education, or English as a second language, and if they've met all other requirements. This was a program wherein if they met the qualifications, the employer, that being their school district, would purchase 1/5 of a year of service credit for that teacher for every year that they qualified, up to a year of service credit. Section 4 of AB 1 of the 23rd Special Session repealed this benefit effective July 1st, 2007, and phases it out over time. So you might wonder why in 2022 we are still talking about this benefit. But the way that it was phased out is if an employee elected to continue in the 1/5 of a year purchase program, their participation ceased when the employee had received, after the election, 1 year of service credit. Because people move in and out of being eligible, we do still have people who elected prior to 2007 to participate in this program who have not had a full year of service credit purchased for them. The spreadsheet on page 357 reflects purchases for calendar years 2021 and 2022. In calendar year 2021, the system received $266,695 for 44 purchases. In 2022, it was $250,153 for 39 purchases. So you'll see this is phasing out, but there are still some people eligible for this benefit. Right now, it is all within Clark and Washoe counties. Since inception, the system has received over $148 million for 41,771 purchases. So I do believe we are on the tail end of this, and hopefully the next few IRBC meetings will be the last that we report on this benefit.
Thank you very much. Any questions from the committee? If not, we'll move on. Thank you.
And Madam Chair, the next, Tina List for the record, the next item is a report on the Retirement Benefits Investment Fund, and Rick Combs is the contract administrator, and he's in Carson City.
Thank you very much. And Mr. Combs, please go ahead when you're ready.
Good morning.
Good to see you.
Good morning. Good to see all of you as well. As Tina said, I'm the part-time contract administrator for the Retirement Benefits Investment Fund. I'll just give you a little bit of brief history about the fund's creation. I know some of you are new to the committee and didn't hear this a year ago, but hopefully this will supplement the materials your staff has provided you. But the Retirement Benefits Investment Fund was created in 2007. It was through a bill that was requested by the Committee on Local Government Finance at that time. And the Committee on Local Government Finance really had two goals. The first was to authorize local governments to create irrevocable trusts in which they could place funds that were going to be basically held to offset liabilities for other post-employment benefits. So that would be any post-employment benefit that isn't a pension, healthcare being obviously the largest one and the one that was discussed earlier by Ms. Rich. The second goal was, since the liabilities for those long-term, for those benefits are long-term, they also wanted to provide some flexibility for local governments to invest in long-term investments rather than the short-term investments they're normally limited to under statute. And so as a result, legislation was passed to authorize the local governments to create their own irrevocable trusts that they could set aside money in. These were basically in response to the Government Accounting Standards Board's statements back at the time that required government entities to reflect the liabilities on their balance sheets, and then stated that if they wanted to then offset those liabilities on their balance sheets, then those funds that were set aside had to be in an irrevocable trust in order to do that. Moving on to the administration of the Retirement Benefits Investment Fund, it's pursuant to that enabling statute, it's administered by a board called the Retirement Benefits Investment Board that is made up of the same members as the PERS Board. It is a separate legal entity. It has its own agendized meetings, but it is made up of the same members as the PERS Board. The board is authorized to employ staff and enter into contracts for services, and then they're authorized to assess reasonable charges against the fund for the costs of staff and any contract services. From its inception to October of 2020, the PERS staff handled all of the administrative services provided for the fund. In October of 2020, the board did decide to put the administrator services under a separate contract. The board still relies on PERS staff for all of the investment and accounting services for the fund. Performance-wise, the fund balance as of the close of FY22 was $701.5 million. The FY 2022 return, very similarly to the judicial retirement system and legislative retirement system, was minus 9.4%. Since its inception in early 2008, the fund has returned an average of 6.7%. You can see those dollar amounts in the tables included on pages 363 and 364 of your meeting packet. Although the funds in RBIF are managed in the same way as Steve Edmondson indicated earlier with the judicial and legislative retirement funds, there is that slight difference that there are the minor differences in the structure because of the fact that the Retirement Benefits Investment Fund is smaller than PERS. It does not invest in those private equities and real estate investments that PERS is involved in. Notwithstanding that, for the last 10 years, the return of the Retirement Benefits Investment Fund is within 0.5% of the PERS fund. These results confirm the board's success in meeting the statutory requirement that the Retirement Benefits Investment Fund be invested in the same manner as money in the PERS fund is invested. Madam Chair, at the bottom of page 362 of your packet, you'll see the current 12 entities who are participating in the Retirement Benefit Investment Fund at the current time. I note in the document that PEB did remove its small amount that was remaining from the fund, and they no longer invest in the Retirement Benefits Investment Fund. As you'll note, the two largest entities in terms of their investments are the Washoe County and Clark County. Madam Chair, you asked earlier about why you don't see more local governments listed here and maybe some that you might expect to see. And it's just worthy to note that when this legislation was passed back in 2007, it was purely providing authority for the local governments to do this. There is no requirement that they participate in the fund, and I wouldn't say that necessarily means they aren't handling their liability appropriately just by virtue of the fact that they're not involved in the fund. First of all, the enabling legislation gave them the authority of whether or not to create the irrevocable trusts at the local level in the first place. And then once, even if they did create an irrevocable trust, the Retirement Benefits Investment Fund isn't the only investment that they can make. The statute says that they can also invest it in any investment that's authorized for a local government under NRS 355.710. That is I'm sorry, I think it's 170, not 710, but I think that section provides a long list of short-term investments that local governments can make. And so it's possible that some of the entities that aren't participating in RBIF are instead using other types of investments in which to invest their funds. And then they were also given the authority to invest in any stocks or bonds outside of RBIF if they got approval from the local Committee on Local Government Finance. The regulations of the Committee on Local Government Finance, as my most recent review of them, pretty much allow entities that have over $100 million to, basically come up with their own investment strategy if they choose to do so. And if they're under $100 million in their trust, they can present a plan to the Committee on Local Government Finance and have them approve it. So that's my best guess at why you don't see other entities that you might expect on here. It's just their choice as to how to address the liability for these OPEB benefits. And as Ms. Rich stated earlier, the state, for instance, is no longer contributing to the RBIF. They are on a pay-as-you-go basis, and it's a very strong possibility that many local governments are doing the same thing, especially if they have followed the general direction of some government entities in no longer providing other post-employment benefits for retirees in the future.
Okay, thank you very much. Any questions from the committee? You were thorough as expected, and we'll see you soon. Thank you very much.
Thank you, and thank you for your service.
Please go ahead.
Madam Chair and members of the committee, for the record, my name is Cabrina Fazer. I'm the Operations Officer for the Public Employees Retirement System of Nevada. Agenda item 5.7 provides an update on the status of the new pension administration system. It's called the Public Employees Retirement Information System, or PERIS. Work began with the vendor, Tegrit Software Ventures, on February 22nd, 2021. There was an in-person project kickoff with the vendor and staff on July 13th of 2021. There are 7 phases to the project, with the project completion date set for January of 2025. The milestones that have been accomplished this cycle include phase 4.1, member service requirements, has been completed. The main focus has been on employer reporting, and that has included the design, development, testing, system readiness, and training and documentation in order for our first group of employers to transition to the monthly retirement report using the PERIS system starting in February of 2023. Initially, this was set to be in November of 2022, but was changed to February of 2023 in order to allow more time for user acceptance testing and also the development of training materials for the employers. This changed the payment milestone, but did not impact the total cost of the project since it is a multi-year project. An employer advisory group has also been established ahead of the new pension administration system. This has been a beneficial resource for communication and collaboration. In addition, there were 2 liaison officer conferences held, which gave employers an exposure to the new system. One was in Carson City and the other was in Las Vegas. Data cleansing efforts is also a big part of the new pension administration system, and this has been ongoing since 2019. Prior to the transition of the new of the employers to the PERIS system, we have 99.99% of the employer data from our current system, the Carson system, ready to transition to the target staging database. Those are my prepared remarks, but I'm happy to answer any questions the committee may have regarding the new pension administration system.
Thank you very much. Questions from the committee? I don't see any. Thank you very much. If we don't have any questions, then if you're ready, if that concludes, or if you have more that you would like to give information on, please go ahead.
That concludes what we had prepared, and I do not believe there's any other information we need to provide at this point, but we would like to thank the committee, and we are pleased to be able to be in front of you in person today.
Thank you very much, and we appreciate your information and running this most important system for our state employees and local government employees. Thank you. So with that, we will move to our last agenda item for the day, public comment number 2. This will be the last period of public comment on the agenda, and as a reminder, due to time considerations, please remember 2 minutes, and we will start here in Las Vegas and see if we have anybody to provide testimony during the public comment period. If you will dial 669-900-6833, and when prompted, please put in 9058-7960 and press pound. And when prompted for the participant ID, just please press pound. So we will start here in Las Vegas. I don't see anybody. Will we have anybody? Dr. Irvin, are you back? Thank you very much. Please go ahead in Carson City.
Thank you. Kent Irvin, ERVIN, State President of the Nevada Faculty Alliance, statewide independent association of professional employees at Nevada's public colleges and universities. First, I would like to congratulate PERS for meeting its long-term investment return targets and for beating the market benchmarks in each of the past 2 years. That's with just 2 investment officials on public servant salaries, part of PERS' low-cost approach. In contrast, for example, there's a teacher's pension plan in a large Midwestern state with an investment staff of 100 who gives themselves bonuses costing millions based on benchmarks they themselves establish. The PERS board took the advice of actuaries and adopted more conservative assumptions last year about future investment returns and payroll growth. That is fiscally prudent. As a result, though, PERS is no longer allowing negative amortization on the unfunded liability, which is also fiscally prudent. But as a result, of course, the total retirement contribution rate is going up substantially this biennium, and it will likely go up again next biennium. The legislature and governor need to act to offset the increases for employees. That could be done with pay increases in excess of inflation, or the state could permanently cap the employee portion of the retirement contribution for employees, with the state picking up the remainder, as Ms. Lee told us is common in other states. That would be more fair for current employees because a large portion of the contribution is paying off liabilities that have been accumulating since 1984. Finally, with the Economic Forum increasing the budget by over $2 billion compared with the current biennium, it is time to treat state employees as our dedicated public servants deserve, and with competitive compensation and benefits so we can fill vacancies and provide full service to our citizens. Thank you.
Thank you very much, and I appreciate your comments. Anyone else in Carson City? If no one else is there, we will go to the phones. BPS, when you're ready, please let us know.
Chair, the public line is open and working. However, there are no callers at this time.
Okay, we'll pause just a minute to make sure that we're not waiting for anybody. And if we have no one joining us, that will finish our meeting. And I would like to thank all of the staff and our new member and our existing members for being here today. And thank you very much for your expertise. And I hope everyone has a fun and safe holiday season. And we will see you very soon in Carson City. Thank you very much, and this meeting is adjourned.